2 of the ICOC and Application Review Subcommittee. Maria, will you please call the roll?
Haifa Abdulhaq, Dan Bernal,
Present.
George Blumenthal,
Here.
Michael Bachin, Linda Boxer,
Present.
Leandra Clark Harvey,
Present.
Anne Marie Dulege,
Present.
Isabel Dudon,
Here.
Mark Fisher Colbury,
Here.
Fred Fisher,
I'm here.
Elena Flowers,
Okay.
Judy Gaston,
Here.
Larry Goldstein,
Here.
David Higgins,
Here.
Steve Julesgard. I think I saw Steve. Oh, you're on mute,
Here,
Steve.
sorry, here.
Thank you. Oh, no, it's really fine. Thank you. James Kovach,
Here.
Rich Lahara,
Here.
Pat Levitt,
Here.
David Lowe,
Here.
Linda Malkus,
Here.
Dave Martin,
Here.
Shlomo Melmed,
Here.
Christine Miskowski, Lauren Miller-Rogan, Adriana Padilla,
Here.
Joe Panetta,
Here.
Al Rolette, Michael Stamos,
Here.
Jonathan Thomas,
Here.
Art Torres,
Here.
Christina Vori,
Here.
Carol Watson,
Here.
Keith Yamamoto.
Here.
Thank you. We have quorum.
Thank you, Maria. Again, welcome everybody. We'll start as always with a few comments from the chair. As we all recall from December, we are now in the midst of our new strategic plan implementation. There's a lot of activity that's been going on at the agency related to that. You see on the agenda, for example, the concept plan for the Alpha Stem Cell Clinic expansion, a new educational program, the programs that we rolled out last year that are legacy with respect to the funding of all the different levels of research continue apace. There's a tremendous amount of activity going on. I wanted to have a couple of updates for you from our colleagues here with respect to specific things highlighted in the strategic plan that are rolled out as a result of the passage of Proposition 14. I'd like to start with Art with an update on where things are with the AAWG. Senator?
Yes, thank you very much, Mr. Chairman and members. We have on our agenda today the approval of our bylaws, which is pretty perfunctory. And I want to thank Kevin Marks and Maria Milan and Maria Bonneville for working so hard and helping us on those bylaws. And you'll be presented to them later in the meeting. Number two, I've been working with the governor's office because they are establishing in the current governor's budget an office of healthcare and accountability. That office is going to be parallel to some of the issues that we'll be confronting in the working group. And as soon as I hear the legislation that they're going to introduce to implement that budget request in the governor's budget, I will send that off to you. It's still pretty new in terms of the budget approval. We won't have a May revise, as we call it, until obviously May. That'll revise the budget in its current form to have any additions or deletions. The legislature will probably begin hearings on the budget in February, March. And then, of course, June 15th is the final day to approve a budget that's balanced and send back to the governor from the legislature. And so this office of healthcare and accountability, which is pretty historic, will be in the budget as well, and also with legislation that'll be implemented and signed by the governor, I'm sure. The other issue that we're going to be taking up, and Maria Milan and Maria Bonneville and Jeff Lomax and others have been working with me, and that is to establish the patient fund. As you recall, in Prop 14, we wanted to make sure when we were writing it initially to get some language that would provide for services for patients. And my experience with One Legacy, the Organ Transplant Foundation, was that we would fund certain organizations like the AVA Foundation for heart transplant patients to give them money to get to a clinical trial, which up until that point they couldn't afford to travel to, but also more importantly, making sure they had enough funds to help pay for their caregiver and expenses while they're receiving an organ transplant. We want to look at how we can provide that for clinical trial participants, because that is so key, especially as we've talked about, and Isabel and others have talked about, and Al, the diversity issues and reaching out into rural communities that may not have access to clinical trial sites. And Jeff Lomax and I have been working on that in terms of the Alpha clinics and also with the community care centers. I've also put Maria Milan in touch with our chancellor's office at UC Merced, as the governor is proposing. We talked about establishing a medical school and a hospital facility at UC Merced, and that would be a prime location to have access to those living in Central California to potential clinical trials as we proceed forward. The Patient Assistance Fund will need to go as a proposal to the Department of Finance, and we'll follow up with that. And again, thank you, Maria Bonneville, for all your help on that issue as we proceed accordingly. So, and we have a few more members that we have approved to the working group. We have 17 total, and it's important to note that one of the prime elements of that is how do we negotiate rates for the future in terms of affordability and accessibility, which is why I really wanted to have James Benedetti, who is currently our point person in Covered California that negotiates all of the contracts with the third-party payers, to be part of this working group to give us an insight as to what we need to look out for in the future. So that's the current update on these issues with the working group, Mr. Chairman.
JT, you're on mute.
Sorry, dog in the background instinctively put it on mute. Thank you, Art, for that. There are a lot of things on the plate for the AAWG coming up, so it's very important that the board hear all that's going on, and we'll keep posted as things proceed throughout the year, of course.
Yes, I will send a notice as to, once we receive an author and the legislative number of the bill that'll help implement this Office of Healthcare and Affordability. This is an issue which is very dear to the heart of our governor, and he and I have talked about this on numerous times. Having had a single mother who passed from breast cancer, and having the inability to reach out for services was always an issue. And I think that he is very sensitive to affordability and accessibility for patients. And I think that's going to be one of the main reasons he put forward this proposal.
Thank you, Art. Another issue, as you know from numerous discussions we've had over recent months, has been the refining of our policy on diversity, equity, and inclusion, and integrating concepts from that into both the projects that are to be awarded by CIRM, as well as the teams that will be running those projects. We've had some discussion since December on this, and I've asked Dr. Sombrano to update the board on where those discussions stand as we continue to refine this policy. Gil?
So thank you, Mr. Chairman. Good morning, everyone. Good to see all of you. So as Chairman Thomas mentioned, for some time now, we've been taking several steps to incorporate diversity, equity, and inclusion into our processes. So review, grants management, other business areas at CIRM, and making it a core part of our organization. And when we began all of this, I'm sure at that point we would have acknowledged that incorporation of this would take and involve some trial and error. And now that we're doing it, we see certainly that it's an ongoing and evolving process. And so we need to continuously assess, learn from what we do, and then make improvements. So it's in that spirit that I want to share one important step that we took, that we kicked off January 3rd, actually, with a mock DEI review where we brought together our board members who serve on the grants working group. And the idea was to bring together this group to evaluate 3 applications from our clinical program that we selected. So these were applications that we had already reviewed before, and have a discussion on how each patient advocate nurse member approached the review of DEI, how effective our instructions and the rubric that we provided was in achieving that task, what elements might be missing or that we can add, and whether everyone was interpreting all of this in the same way. And so that exercise proved to be very informative and provided us with some clear guidance on how to make improvements. We found, for example, that a greater clarity is needed in instructions, both to applicants and reviewers, as to how to use sections in the application that we created. Part of this is reorganizing and reordering some of those sections, needing to develop better examples, in some cases using tables to better capture pertinent information. And so what we're doing now as a follow-up is actively making changes on the application, on our slides that we use to guide reviewers, to roll those out over the next several weeks to several months to improve the process. And as I mentioned at the beginning, it is an ongoing process of assessing and figuring out what we're doing well, what we're not doing so well. So I anticipate that this will be another iteration, and we will make improvements as we need to. And so this will apply not just to review, but also in the post-award, grants management, and other elements that we do. I also just want to take a second to thank and acknowledge our patient advocate and nurse members who serve on the grants working group. They really spend an incredible amount of time in these reviews and in helping us improve that process. So I just want to say thank you and just say that we greatly appreciate their dedication to this. So thank you, Mr. Chairman.
Thank you very much, Dr. Zambrano. We look forward to continuing the process there, and I think we're homing in on procedures to follow that will maximize our goal of integrating DEI into all that we do. So thank you very much for your leadership in this, Gil. We appreciate it.
Mr. Chairman.
Yes, sir, Senator.
Yeah, on that point, I know many of you have heard that the Supreme Court has agreed to hear the 2 Harvard and South Carolina cases on affirmative action and admissions policies. They'll open up arguments October 1st of this year. So it's going to be a case that we're going to have to follow very carefully, because it may give us further guidance or restrict us even further in terms of our diversity elements on these issues.
Thank you. Isabel.
Thank you, Mr. Chair. Gil, I just wanted to say that I'd love to help peruse those documents to the point that even Art made about what appears or doesn't appear acceptable. But I did work, being a member of the IRB for the All of Us Research Program, I was quite adamant about inclusion plans, and I'd like to see how ours are rolling out. So they're very specific about what we expect to hear back from the applicant. So I'd be glad to do a quick run through for you. I appreciate all the people who've done some advisory work already, but I'd be glad to take a look at him as well.
Thank you. We appreciate that.
Thank you. So in addition to these programs and the new concept plans, et cetera, that we're advancing, you'll recall last year we had some workshops that helped inform the development of the strategic plan. And the plan now being in place, there are going to be a number of upcoming meetings in the form of workshops that examine certain elements of the strategic plan. February, for example, there's going to be one, as you recall, we have $1.5 billion in Prop 14 that is allocated to diseases of the brain. So we're going to have a meeting to talk about CNS collaborative research programs that can further advance our strategic plan goal of advancing world-class science. Dr. Canet Avias is our point person on that. Another program that's going to be the subject for a workshop later in the spring is going to examine community needs that can inform the concept plan for the community care centers of excellence. Also a key addition in Prop 14, Maria Bonneville is the lead on that. So stay tuned for reports on those as they go forward. Last but not least, one of the things that the agency is going to be dealing with this year is, as we've mentioned, Art and I are both termed out December 31 this year, and the process of picking a new chair and vice chair will be the subject matter of discussion that's kicking off with a subcommittee meeting of the governance subcommittee in March, which will then yield a report to our full board meeting also in March after that. So there will be a lot of activity in connection with that pair of selections going forward. So that concludes my chair's report. I'll turn it over now to Dr. Milan to give her president's report, which will feature comments from her as well as General Counsel Kevin Marks. Maria?
Thank you so much, Chairman Thomas, members of the board, the public, and colleagues. I'm going to be very brief, but I wanted to give an update, a 1-month update, since this board approved our strategic plan. Next slide, please. So as you'll recall, the mission statement as stated here is accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. Everything we do relates to this mission statement and our strategic goals. Next slide, please. Really emanate from this mission statement. So you will recall that the 3 major categories of our 5-year strategic goals with defined goals that we set in December are in the categories of advancing world-class science, developing these programs to optimize how we can push science forward and get the most return on investment, deliver real-world solutions toward commercialization, patient delivery, access, and all other things related to the ecosystem that needs to support this emerging and growing field, and provide opportunity for all that speaks to developing a diverse and highly skilled workforce all throughout, from training all the way through final career pathways. And then a major one is deliver a roadmap for access and affordability that Senator Torres touched on earlier when he spoke about the AAWG and consideration of priorities and direction. Next slide, please. So in accomplishing this, in terms of our research programs, we continue to leverage the pillars of funding, which are in some cases recurrent funding opportunities, such as in the discovery program, translational and clinical, and as well as the education programs. Our most productive program for the first part of launch have been the education programs. And then under infrastructure, a variety of programs, some of which you'll hear today, or one of which you'll hear today. These are all intended to deliver on the 3 major pillars of our goals. Next slide, please. So as an update on these pillars, in terms of advancing world-class science, our grants management team had just most recently reported that we have 207 active awards. It's notable that 1/3 of the funding for these active awards has been through Prop 14. Approximately $279 million has been deployed thus far since January of last year. That's incredible to think about what would have happened if Prop 14 wasn't here and the amazing science that is currently being funded. In addition, as Chairman Thomas had reported, we are in the midst of new scientific program concept proposals, and you'll be hearing those in March and in May. And
Yes.
in terms, I'm sorry, was there a question? Okay, and then in terms of the category of delivering real-world solution, you will hear the concept proposal for the Alpha Clinics network expansion today from Jeff Lomax. And then there is a concept underway that's being developed by our business development and our science team working together for a new manufacturing network concept proposal. Again, the rationale and the plans were outlined in the strategic plan. Our education programs are continuing to build on a variety of on-ramps for along the educational spectrum for building the workforce and leadership of tomorrow. And today you'll hear a new education program presented by Dr. Kelly Shepard and Dr. Kenneth Vilas, this group, the EDUC 5 concept proposal. And we, in relation to the access and affordability goals, we are underway with the recruitment for a Vice President of Medical Affairs and Policy, and there's been so far tremendous response to that posting, and so we're very encouraged by that. Next slide, please. And so that's my president's report. I welcome any questions on that before I introduce Kevin Marks, our general counsel, who also leads our administrative programs, including grants management, legal compliance and IP, human resources, and I think that's it, right, Kevin? Well, he does a lot of things, so he's going to be reporting on two major announcements for us today. But before I turn it over to Kevin, I welcome any comments or questions from the board. Chairman Thomas.
Anybody have questions or comments for Dr. Milan? Okay, as you can see, there's a lot going on. Very exciting, and look forward to seeing all of this play out. Okay, Maria, please introduce Kevin.
Okay, Kevin, I think I introduced you, so here you go. Kevin Marks.
He needs a drum roll.
Kevin, you're on mute.
Still on mute. Maybe you can go to Maria's computer. Oh, you are on Maria's computer.
The famous Zoom phrase, "You're on mute."
No.
Oh, that's why she's on headphones.
There we go. All right, how about now? Are we good?
Good.
Great. Sorry about that. We're experiencing some technical difficulties in the office. So as much as I would love to claim that I am Maria Gonzalez Bonneville, I am not. I'm just using her computer. So the report I'm coming with you today has two parts. So the first relates to an announcement regarding our future office space and new CIRM headquarters. So as the board is aware, the board authorized CIRM staff last year to explore new leasing options as our current lease in Oakland was expiring. We are happy to report that we've recently signed a new lease to move the CIRM headquarters from Oakland to South San Francisco, specifically the Gateway complex located at 601 Gateway Boulevard in South San Francisco. As a reminder, in our search for new properties, we wanted to focus on a few key factors. They included cost, both rental costs and build out costs, increased and more flexible square footage for use in the office space, accessibility for the board, convenience to airports, hotels, meeting space, and last but certainly not least, employee amenities, which would include a central location to the employee population, various transportation options, parking, and dining options. So in taking those factors and working with the state and CBRE, who is the state's real estate brokers, we narrowed the choices down to 5 located in San Francisco, Oakland, and South San Francisco. In applying those factors that I mentioned and in consultation with Chairman Thomas and Vice Chair Torres, we decided on the Gateway Boulevard location. So our lease begins on June 1 and goes for 8 years. We do have an early out at 4 years, which allows us flexibility depending on our current circumstances. The new office space expands our footprint from about 13,000 square feet that we have here in Oakland to just short of 17,000 square feet to account for the growth of the agency. As our current lease in Oakland expires at the end of March, we'll be working virtually for a period of time, much like we've been working now for the past 2 years, until the build out is complete. We're also working through some temporary meeting space options to allow for in-person meetings if needed over the next few months. So with that, and before I move on to the second topic, I'll take any questions. Okay, good. Seeing none, I'll move on to the second. So the second part of my report is to talk about recent funds that CIRM has received from Stanford University related to 3 CIRM grants under which Stanford developed several CIRM-funded inventions and CIRM-funded technologies. Stanford in turn packaged up that collective IP and entered into an exclusive license with 47 Inc., through which Stanford outlicensed this IP. As part of this license, Stanford received equity and other licensing revenue in 47 Inc. And as you know, it was subsequently acquired by Gilead. So pursuant to both the statutory and regulatory provisions that govern the 3 grants, on January 7th, Stanford made a payment to the state of $15.6 million as its revenue sharing portion. And that's calculated as of August 31st, 2001, or I'm sorry, 2021. This payment comes as a result of several conversations between Stanford and CIRM staff. We agree collectively that this payment represents the correct calculation of the amount that's due and owing by Stanford under this current license. There may be some other payments due to CIRM depending on the commercial viability and success of the program and of the assets that were licensed. The $15.6 million has been placed into an account with the Department of Finance and earmarked to be used for patient assistance for therapies that were and are funded by CIRM. And I think Vice Chair Torres briefly mentioned the ability to use those funds for patient-assisted activities. So with that, that's the end of my report. And again, I'll take any questions.
Any comments or questions from members of the board? Thank you, Kevin, on both fronts. I know that you and the team have worked extremely hard on the new office space for many, many months. So it's good that that is moving along, and we will be able to start there in the not too distant future, and hopefully be able to have people actually meet together and see each other. Should be a novel concept. On the Stanford Award, I just want to thank members of the CIRM team who worked on this. Many did. Particular shout out to Dr. Milan and to board member Jules Gard for their help, and Kevin and Ben, members of the legal team, etc. So thank you. Are there any other comments on either of these topics?
It was a really nice, this is Linda Malkus, that was a really nice chunk of change and from Stanford. So that's kudos to the group. And if there's any way to highlight it out into the world, that would be a good thing.
It took some tough negotiating. So again, Kevin and Maria, thank you for all your hard work. And Kevin, thank you and team, thank you for the hard work on the office space. Having been involved with JT and others in the first office space to Oakland, I know the tough job you had. So thank you again.
You're very welcome. Thank you.
Okay, are there any other comments or questions on either topic from members of the board? Seeing none, okay, thank you very much, Kevin. That concludes the president's report. We're going to proceed now to items on the agenda. First up, item 5, consideration of minutes for the December 14th board meeting. Do we have a motion to approve?
Move to approve.
Second.
Is that, who was the second? Is that George?
Yeah, that was me.
George, yes. Okay. Maria, I guess we need to call the roll on this. Oh, ministerial though it is.
Yeah, let me just get back. We had to switch around again. So let me just get back to the motion. Okay. Haifam Abdulhaq. Dan
Yes.
Bernal.
Aye.
Thank you. Aye. George Blumenthal.
Yes.
Michael Botchin. Linda Boxer.
Yes.
Leandra Clark Harvey. Leandra.
Yes.
Thank you. Anne-Marie Dulege.
Yes.
Isabel Dudon.
Yes.
Mark Fisher Colbury.
Aye.
Fred Fisher.
Aye.
Elena Flowers. Judy Gasson.
Yes.
Larry Goldstein.
Yes.
David Higgins.
Yes. Yes.
Steve Julesgaard.
Yes.
James Kovach.
Yes.
Rich Lahara.
Yes.
Pat Levitt.
Yes.
David Lowe.
Yes.
Linda Malkus.
Yes.
Dave Martin.
Yes.
Shlomo Melmed.
Yes.
Christine Muskowski. Lauren Miller Rogan. Adriana Padilla.
Yes.
Joe Panetta.
Yes.
Al Roulette. Michael Stamos.
Yes.
Jonathan Thomas.
Yes.
Art Torres.
Aye.
Christina Vori.
Yes.
Carol Watson. Carol. Keith Yamamoto.
Yes.
Thank you. The motion carries.
Thank you, Maria. Next up, consideration of new appointments and reappointments to the grants working group members. Dr. Sombrano.
Hello again. So we're bringing for your consideration 6 nominations for grants working group membership to continue to expand our pool of experts. And as typically the case, all nominees have served as non-voting specialist reviewers in a couple of instances, and that helps give us an opportunity to assess their experience and their capability as reviewers. The list of nominees has been reviewed by the CIRM leadership, and we recommend their appointment. These individuals' bios are provided in the materials of the board, and they include Drs. Deborah K. Armstrong, Elizabeth Connick, Julian Hiscox, Clark Hung, Martha Rook, and Daniel Saris. And in addition to these 6 new appointments, we also have 12 existing grants working group members whose terms are expiring, but we wish to reappoint to retain their expertise. And so their bios and terms are also provided in the summary sheet that we provided to you. So we are seeking approval of those 6 members and the 12 reappointments. So thank you, Mr. Chairman.
Thank you, Gil. Do we have a motion to that effect?
I can make the motion.
Thank you, Anne Marie. A second?
Second.
Thank you, Dan. Any questions or comments on this item?
JD, a brief comment to say that I'm always very impressed by the way these members, our future members, are selected. They're always very high caliber, and I can't recall one instance where someone from the board disagreed with the proposal from the CIRM. And I want to say that that's a great testimony to the quality of the work that the CIRM is doing in ensuring that these grants are reviewed by the best possible people as a group.
Thank you, Anne Marie. Any additional comments?
Sorry. JT?
Isabel?
I agree with Anne Marie. I just want to make sure that in our outreach and inclusion, that we do our best to make sure that we're representing as best we can and searching as best we can some of our representatives from the racial and ethnic communities as well. Really want to hear diverse voices and make sure that they're also represented at the highest levels of our review. So thank you very much. I appreciate bringing stellar people aboard. I'd like to see more from our communities represented. Thank you.
Thank you, Isabel. Any other questions or comments? Any comments from members of the public? Hearing none. Maria, will you please call the roll?
Haifa Abdulhak,
Yes.
George Blumenthal,
Yes.
Michael Botchin, Linda Boxer,
Yes.
Leandra Clark Harvey,
Yes.
Anne Marie Dulege,
Yes.
Isabel Dudon,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Elena Flowers, Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
James Kovach. Jim, are you there? Rich Lahara,
Yes.
Pat Levitt,
Yes.
David Lowe,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Christine Miskowski, Lauren Miller Rogan, Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette, Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres. Art, you're on mute.
I'm so sorry. Aye.
Thank you. Christina Vori,
Yes.
Carol Watson, Keith Yamamoto.
Yes.
Thank you. The motion carries.
Thanks, Maria. And I would just like, every once in a while, it's always good to make a comment. We kind of take the GWG for granted because they're such a fundamental part of what CIRM does. But having sat in on every GWG since I started, for those members of the board who have not been involved in the reviews themselves, the caliber of the participants and the quality of the work, the exceptional diligence and analysis that they bring to the table in every single GWG meeting is really impressive. And it is sort of the meat and potatoes that drives the whole CIRM operation. So just to make sure the board understands that the members of the GWG take things extraordinarily seriously and offer rigorous commentary that really informs the best result. That's my first point. The second point is it's always interesting to hear from the members of the GWG how much they enjoy being a part of the CIRM process. Virtually all of them are NIH reviewers and reviewers for other institutions. And they, without fail, comment how literally the CIRM reviews are the favorite reviews that they're a part of, which is always good to hear and further helps them want to put in all the time and effort that they do to make the operation work. So I thought members of the board would appreciate hearing that. Finally, just a shout out to Gil and all the members of the review team. They have many reviews to deal with. This year in particular, going, I believe, be an all-time record number of reviews. And they always execute with the utmost professionalism and make the process go like clockwork. So to Gil and the team, thank you for all you do. Okay, on
Hey,
to
Isabel has her
Yes.
hand raised, JT.
yes, Isabel.
First of all, JT, I really want to echo your sentiments. When I take a look at even the titles for the reviews they have to do, I'm going, oh my God, what the heck are they talking about? The fact that they are reviewing so many very complex scientific projects, I kudos to them. I think that my remarks about diversity and inclusion amongst these reviewers also goes to my fear that if we can't find experts from racial and ethnic communities, it's because one, we haven't tried hard enough, or two, they're not there. And that means the system in and of itself is not creating, allowing, or impacting the growth of experts from our communities. They're not coming into the science schools. They're not graduating. They're not getting a pathway to become these experts. So that's sort of a reflection more of my concern. And I keep thinking, what can I do to help change that model or that barrier? And I welcome anybody else's ideas about that, because I think that if CIRM can be very intentional and reflective about outwards towards the rest of the academic communities and other areas where there's this expertise is required, that they too be very intentional in trying to help develop those pipelines. Because I would love to see a lot more young Latino scientists, and I'd love to see them grow expertise, and I'd love to see them have these kinds of opportunities to sit there at the top of the food chain with an expertise and bringing a lived experience that adds to the depth and the breadth of the kind of research that is being done. And that's my concern when I make these remarks. And that's obviously, Maria, why I love the idea of the Spark and the Bridges and all of those programs, which we hope are creating those opportunities. So I do not want to belittle any of the folk who are doing this very difficult review. I just would like to see some new folk aboard or different folk aboard. That's all. Thank you very much.
Thank you, Isabel. David?
JT, could you just give us a brief assessment of the reasons in your mind or what you hear for the reviews being so favorable and enjoyed or appreciated by the GWG?
Well, not being a reviewer myself obviously for CIRM or for other organizations, I don't know exactly what goes on when they are reviewing for others. But all I can say is they make the summary comment that the processes that we have in place are such that they very much enjoy participating. We've got overwhelming response from our reviewers when Prop 14 passed, and it was clear that CIRM was going to continue. Remember at the last GWG meeting before the election in 2020, there was this sort of sense of concern and worry that were Prop 14 not to pass, the CIRM would no longer exist in its current form, and there were lots of sort of testimonials and comments at that GWG about what a pleasure it's been to serve and how much they appreciated the opportunity and what great work is coming out of it. So I can't give you specifics. I can just sort of tell you what they said about what we do, and that they think that it's our practices are best in class, and it's just a pleasure for them to participate. That's about the best I can say on that, but thank you for asking. Any other comments or questions? It's Fred. Yes.
I think, well, as a patient advocate on the GWG, it's been extraordinary for me to see the the acumen and the commitment and the scientific rigor that those reviewers bring to the process. And I think, like all of us that want to make a difference in the world and want to have an impact on people, when you have the combination of the opportunity to review the best science and actually have the funding to move it forward, that's an extraordinarily rewarding opportunity, because you get to apply your expertise in a way that really has a chance to move the needle on the thing you've dedicated your life to. So I haven't heard that from any of them, but I can, having watched the commitment that they bring to the process, I have to think that's part of an element. And to be able to do it in such a collegial way, where they're not in their own lab, they're not in their own institution, they're actually interacting with people literally from across the globe. So it is an extraordinary experience to witness myself, and I'm guessing it has, that's part of why it has such extraordinary value to the people who do it. And I'm grateful to them for the incredible amount of time they dedicate to it.
Thank you, Fred. Art, before I turn to you, I'll just comment following Fred's comments that a key part of the GWG has always been and continues to be the significant involvement by our patient advocates who are members of the GWG, who bring a most important perspective to the table for those discussions, and who uniformly are highly respected by our scientific members of the group. So to all of our patient advocates who are participants in that, thank you very much for your great dedication on that, on top of everything else that you have to do here with CIRM. Art.
Yes, I've served on every group as a cancer advocate, patient advocate, since I came on board in 2009. And so over the years, I know some of us have not had the opportunity to have in-person meetings, but it is a very international group of people that are very dedicated to their patients, very dedicated to the sciences, and always complimenting us on how far more advanced we are than the NIH grant participation, how the staff has been so productive and so supportive. Most of the diversity that Isabel talked about has really come from our patient advocates who have served on the board, specifically Dr. Prieto, also Al Roulette and others that have been participatory, Dan Bernal now as well. But again, we are suffering from African-American admissions into our university, from Latinos in the sciences. And there's one guy on this board who has done more than anybody, I think, to help recruit, especially Latinos, and that's former Chancellor George Blumenthal from Santa Cruz, who I know is very dedicated to sciences. And I know that campus under his leadership really provided the outreach. So it's going to take time as we increase those numbers, because we're lacking in terms of professors, we're lacking in terms of scientists, we're lacking in terms of other areas where we could bring certain people to these group reviews. So I'm looking forward to that time when we improve those numbers. Thank you.
Thank you, Art. David, do you have another comment?
Just very briefly, I think that this is important enough for other funding agencies globally that someone, a small group, maybe CIRM and some participants, should write a short summary of why it seems to be so appreciated and successful, and share it, publish it.
That's a very interesting idea. Thank you, David. I will say that you may recall several years ago that Randy and Maria and members of the CIRM team went back to NIH at NIH's invitation to meet with leaders of various institutes at the NIH to describe these best in class processes that we have in place, and which was a great opportunity for CIRM to inform them, but also a real vindication of, from the highest possible funding level organization, that what we are doing is really viewed as the expert process that we all know it to be. So, but that's a very good idea, David. So thank you. Okay, any other comments on that topic? Okay, we are now going to move into the part of the meeting that is the application review subcommittee. And the first item for consideration is item number 7, consideration of applications submitted in response to DISC 2 partnering opportunity for discovery stage research projects. I have a presentation by Dr. Sombrano. Gil.
Okay, thank you, Mr. Chairman. I'm going to share my screen. All right, so we're bringing to you the recommendations from the grants working group related to the Discovery 2 funding opportunity. And so I want to provide you a little background on what DISC 2 is, also known as Quest. But this funding opportunity falls into our early set of core programs intended to take ideas and help them develop their project into a single product candidate. And so we offer this opportunity twice per year, so every 6 months. And the goal is to create the beginnings of a pipeline that ultimately will and hopefully will lead to a clinical trial. So therefore, the objective of this program, as written here, is to promote the discovery of promising new stem cell-based and now gene therapy technologies under Prop 14 that can be translated to enable broad use and ultimately improve patient care. And so we look for proposals where the technology is either uniquely enabled by human stem progenitor cells or directly reprogrammed cells, or that are uniquely enabling for the advancement of a stem cell-based therapy, or that is aimed at developing a gene therapy approach. We, in assessing projects, consider different types of product candidates. So you have mostly therapeutics, so things such as a cell therapy or a small molecule or something that acts on a stem cell in some way, which is the most common type. But we also consider diagnostics, devices, and tools, research tools in particular, that may help with stem cell or gene therapy approaches. And from these projects, what we're looking for is for them over the course of 24 months to develop and identify a single product candidate that they can then take to translational studies. Part of that process is making sure that they develop a target product profile that will guide the development of that product into future development stages. And for a therapeutic, we want to make sure that they propose studies that are going to allow them to show disease modifying activity for that product candidate, and for a diagnostic device or tool that they show scientific proof of concept for those products. And just looking here at the overall timeline as to how that Quest or Discovery 2 opportunity fits in. So these initial 24 months should get projects to identify that single candidate. And then there are a couple of other opportunities that follow that are available through CIRM. So in the case of a therapeutic, there's the TRAN1, which allows them then to conduct those translational studies, often for about 30 months, and then culminate in a pre-IND meeting. After that, to engage in IND enabling work, usually for a couple of more years before they do their IND filing and go into the clinic. So again, we're talking about DISC 2, the very earliest stage over a 24-month period. So here is a slide showing what the review criteria for the grants working group was in assessing these projects and scoring them. So there were 5 key questions that went into determining their score. The first is, does the project hold the necessary and significance and potential for impact? Meaning, what value does it offer? And is this something that is ultimately worth doing? Is the rationale sound? Is the project well planned and designed? Is it feasible? That is, do they have the resources and qualified personnel to conduct the project? And then lastly, does the project address the needs of underserved communities? In doing the review and evaluation of applications for the Discovery 2, we use what we call the positive selection or 2-stage review process. And we do this when we have opportunities where we get many applications and the total number of applications will exceed the capacity of the grants working group to review in a single session. And so in the first stage of this process, the grants working group panel, including the patient advocate and nurse board members, do a pre-review of the applications and select which ones should advance to the full review, looking really at the big picture of the application, those that may demonstrate the greatest potential for impact and significance in their proposals. So the CIRM president and CIRM team also examined the non-selected applications to determine if any of those that weren't selected by the GWG would merit a full review. And once we do that, then the remainder are then deemed to be not to advance, so that the review for those ends. So in this case, we had a total of 79 eligible applications that came in and were assessed in this way. 50 were selected that then advanced to full discussion stage by the GWG. The scoring system that is utilized by the GWG to assess these is on a scale of 1 to 100. So those that receive a score between 85 and 100 are recommended for funding, whereas those that receive a score between 1 and 84 are not recommended for funding. So basically, this is a thumbs up or thumbs down using the score. And because we use the median in order to determine the score, that means that the outcome is driven by the majority score of the scientific members. Now, in this particular review, we instituted a new policy for those applications that receive a score of 80 to 84. And we made sure that the grants working group members knew this as they were scoring, that if they score the application between 80 and 84, that they deemed that the application had sufficient merit to bypass the positive selection process, which I described in the previous slide, and advance to full scientific review if submitted in the next cycle. The idea behind this was to capture projects that aren't quite ready to be funded, but that certainly show promise and that they would like maybe just some clarification, some additional data, an improved design that they would like to see again. And so that offered them that opportunity to score projects in this way. And so to summarize the recommendations from the grants working group, we had of the 50 applications, there were 16 that scored 85 or above and are therefore recommended for funding. And the total funding request for those 16 applications is about 20.8 million. The funds available are 40 million to cover 2 cycles. So this is the first cycle of 2 that we will have in this fiscal year. So the amount that is recommended is just over half of what we have for those 2 cycles. In addition, we had 16 applications among these 34 that scored within that 80 to 84 that will be able to bypass the positive selection process in the next cycle, just as an FYI. The other thing I want to mention is that under Prop 14, we have a new policy that any application that is not recommended for funding by the GWG, but which has 35% or more members score to fund the application, must include a minority report. And so the minority report is one that is put together by the CIRM review team that summarizes and provides a synopsis of the opinion of the reviewers that scored 85 or above. We share this summary with the reviewers to ensure that it accurately reflects their comments and view on the application. And so in this cycle, we had 1 application that qualified for a minority report. That one was DISC 213163. With a score of 84, you can see that there were 6 scientific members that scored 85 or above. There were 9 that scored below 85. The range of scores was 82 to 86 on that particular application. This one is entitled Ipse Extracellular Vesicles for Diabetes Therapy. And it is a biologic and scaffold combination, extracellular vesicles that are secreted by iPSCs, which are intended to suppress the immune system and dampen the effects of type 1 diabetes. And so this application is among the ones that are provided in the summary documents that you have before you. The CIRM team is not specifically recommending to fund or not to fund, but it is available like all others for you to review. If you choose to fund it like any other application, of course, we will make sure that we support the success of all of these applications to the extent that we can. And so with that, I will stop sharing this screen. And Mr. Chairman, I'm just going to put up I'm going to share the Excel sheet, which has the listing of all the applications, and you should be able to see that as well in the materials, but I'm going to just flash it up there. Okay, and hopefully you can see that. So we have the 16 applications that go down to 13221, and then we have right below that the one that qualified them for the minority report. So Mr. Chairman, I'll turn it back to you.
Okay, thank you. First of all, do we have any motions to elevate any of those? Yes.
Fisher has his hand raised, so I'm not sure if you wanted to comment on something from the presentation.
I couldn't see that, sorry. Yes, Fred.
Gil, could you clarify on the majority scored do not fund, but the range was 82 to 86. A score of 86 would be in the fundable range. So could you explain how a score of 86 ended up in the do not fund group?
Well, the score was 84, so it's based on the median. The range of scores given by the individual scientific members ranged between 82 and 86. So there were 6 members that scored that application as an 85 or an 86. And there were 9 members that scored it essentially between 82 and 84.
I see, thank you.
Yes, Mark.
Yeah, as the patient representative for type 1 diabetes, I wanted to make a recommendation that it actually get funded. I think this is a phenomenon where it's clearly right here on the bubble from that perspective. And the characterization on some of the comments during the review was interesting in the perspective of the adjective. It's a very CIRM type of proposal, if you will, in the context that there can be some very unique discoveries that are occurring from taking this approach. So I just wanted to make that recommendation for funding.
Okay. By the way, for those of you new members, the term CIRM was originally coined by Mark Noble, one of our venerable reviewers at the University of Rochester, and has sort of taken on a life of its own over the years, one of our finer expressions. Okay, so we need as I was getting to, is there a motion to move any of those not recommended for funding up to the recommended for funding range?
Does Mark need a second for that?
Yes, he does.
May I second?
JT, this is Kevin. We don't have a motion.
We need a formal motion. So Mark, do you make that motion?
Yeah, I'll make that formal motion that I recommend that proposal get funded. So thank you.
And if I'm not conflicted, I want to second it.
Or you cannot make a motion.
No.
Okay, thank you.
Do we have a second? I'll make the second. Do we have discussion by members of the board?
Yeah, I'm happy.
Anne Marie.
Yeah, so this is exactly one of our most important mandates, is to discuss those that either have just made it or have not yet just made it around the bubble, like your mark, or around the bar. So I'd like to see if anyone can tell me what would be the reasons in this application to change the recommendation or the outcome of the joint recommendation from the GWG. I'd like to understand it. I'm rather in favor of it, but I'd like to have a rationale for it.
And here, the alternative would be to go back to the applicant with comments and have them resubmit, right? And so I guess part of what you're asking is, what's the rationale for moving forward without that and skip that step in this process?
Mark has his hand
right.
raised.
Yeah, that's right, Fred. And the reason is because, you know, we all are convinced that the GWG is doing an excellent job. It is indeed our responsibility to scrutinize those that are, again, as I call it, around the bar, above or below. But we have to have a rationale to really, frankly, modify the recommendation.
So let's, Mark, as the maker of the motion, could you please address Anne Marie's question?
Yeah, that's a great question, and obviously a very important one for consideration whenever you're making an adjustment to the GWG. I think this was just on the knife edge of that, and so in that context, it doesn't take much to tip it over into an approval cycle. You know, from my perspective, the elements around the science behind this are the kinds of things that have the opportunity for high risk, high reward phenomenon. And I just taking the view of, related to that CIRM adjective, is taking that and giving it a little extra consideration just to tip it over into the approval category for that reason. That's exactly the kind of research effort that CIRM has been supporting overall, and that's really the rationale from my view.
Okay.
If you don't mind, may I respond to this?
Certainly. Actually, Anne Marie, before you do, I further illumination on your question would come from Gil. If you could talk about, there is a minority report which addresses the reasons why those reviewers believe this should be funded, and that would help inform the answer to Anne Marie.
Sure, Mr. Chairman, I can read the minority report, which is just a paragraph. So the panelists who gave this application a score of 85 or above were positive about the iPSC, the extracellular vesicle approach, and potential impact among people with type 1 diabetes. This group noted convincing proof of concept data supporting the immunomodulatory effects of the iPSC EV, the vesicles, thoughtful and logical project plans, preparation for pitfalls, and potential to expand the iPSC EV approach to other diseases. One panelist described the proposal as very responsive to CIRM's mission and explicitly acknowledged the pragmatism of developing a therapy, even if we do not know exactly how it works. According to this group, the timeline is realistic and the budget is appropriate. Outstanding concerns in the group were the applicant's limited experience with extracellular vesicles, the challenges in the production of those vesicles, and the practical aspects of translation to the clinic. And so that's the minority report.
Okay, thank you. Okay, thank you. Anne Marie, does that help at all?
Yes, it does. Thank you. And I'd like to still make a quick comment if possible.
Of course.
Okay, so, I really appreciate, Mark, really your position, where you come from. And it's certainly that's one of your roles as an active or patient representative. On the other hand, it's really, I think, our joint responsibility to realize that, one, we're all here to represent patients. There's many of you, and that for me is not a sufficient reason, particularly because we're not saying it should not be funded. We're saying it should come back with addressing some of the concerns in a clearer, more convincing way. And for me, the only reason why I would suggest to modify a recommendation from the GWG would be if one way or another, I thought that their assessment was a bit unfair. There was some level of slight unfairness in their judgment. But I don't hear it here. I think, frankly, they can come back in 3 months with better addressing the concern, then under all likelihood, they would be funded.
Okay, thank you, Anne Marie. Haifa, you had your hand up?
I think my
No.
question was addressed. Thank you.
No. Yeah, thank you.
Okay, thank you. Yes, David.
No, actually, David, you cannot comment either. Sorry.
I can't. I'm not.
It's you have a conflict here, so you cannot comment on this particular.
Oh, okay. Never mind.
You might turn your hand off, David, if you would there. Other comments or questions by members of the board? So just as the seconder of the motion and having sat through the GWG meeting on this, I did find the commentary by those that submitted the minority report to be persuasive in a manner that would lead me to support voting for this to be moved up to the funding range for what that's worth to members of the board.
JT, you're influencing us this way. And I just want to say, I'd love to have a comment that, again, lead me to though, because I obviously this research is extremely important. Can you clarify what you meant by persuasive? Just give us a practical reason why indeed we should vote yes. I'd love to vote yes.
Well, I think the points made by the those that wrote the minority report, which you just heard, were comments that to me suggested that this was worthy of funding. That would be my response to that. Now, others may disagree, which is totally fine. I'm not looking to persuade anybody. I'm just giving you my particular perspective.
My point is actually, and I don't want to, that we spend more time than that on this topic. The more important topics is, it's not whether or not this grant should be funded. It's whether it should be funded now or whether it should come back for review in a few months better addressing the concerns expressed by the GWG. And I'd love to have a very practical reason to say, yes, we can modify that, because I'd love to say yes.
Well, that's.
But I haven't heard any.
An absolutely valid point, and if you haven't found the points made persuasive, that's absolutely fair. So, other comments? Yes, Fred.
Maybe I'm with Anne Marie. I as a patient advocate, I want to do what's in the best interest of patients, but from an accountability point of view, it's good to have a rationale to lean on. And I'm wondering if it would be helpful, or if the staff who have worked with the applicants in the preparation and all of that, if the staff have something to add to this conversation in terms of insight regarding the implications of approving now versus approving when they have the chance to work with the applicant to improve it to the point where everyone is comfortable that it meets the threshold for funding.
JT, before we get to the staff, can I make a couple of points?
Of course.
So let me just read the last sentence from the minority report, and then I want to come back to what I think this all means. It says, outstanding concerns in the group were the applicant's limited experience with EV, challenges in the production of EV, and practical aspects of translation to the clinic. So the first question you have to ask yourself is, are those issues able to be addressed in another go-round or not? It's not clear to me that simply giving them one more bite at the apple is going to change this in the minds of the reviewers. So from my point of view, this is what we've got on the table. I don't see that there's something very specific here that will make a big difference in a second review. But to go back to what our job is, and it's not to rubber stamp necessarily what the GWG provides in terms of scientific scores. We have typically relied on them for a base scientific score, but we've not always done that. We certainly have voted in projects that have a score of 84. It was just a few sessions ago that I remember doing that. So our job is programmatic review. And so to kind of line up with what Mark talked about, we're talking about a very difficult disease, diabetes, type 1 diabetes. And, and there are projects that have higher risk, but have higher reward. And when I look at the reward possibility here, given the how extensive this disease is and the possibility of doing something to help alleviate it, I'm struck with the idea that in programmatic review, that's something that we're supposed to, at least in my mind, take account of. So I'm not sitting here, asking anybody to vote one way or the other, but I'm just pointing out a couple of things that drive my considerations here.
Thank you. Thank you, Steve. Gil, would you like to respond to Fred's question?
Certainly, I can provide maybe a couple of bits of information that might be helpful. So for this application, this actually, in this cycle, is a resubmission. So it means they've gone through the review process twice. If it is not funded, it'll go through then what would be a third review to make improvements again. Going through that review process, although it received a score of 84 and means it will bypass positive selection, certainly doesn't necessarily guarantee that an application will be funded, because a lot of it depends on the context of what those other applications that come in look like as well. As I mentioned, there are 16 applications total that received a score of 80 to 84 that are basically going to be working on making improvements in order to resubmit. So that is one bit of information. The other is related to the budget. As I mentioned, the amount that the recommended portion of applications would use up is it's almost 21 million out of the 40 million. If this were also funded, that would leave about 18 million for the next cycle. So it would be a little less than this cycle. So it's pretty near half. I don't know if that has any impact, but it's just something to be aware of in terms of the overall budget amount.
Thank you, Gil. Fred.
So if I understand Stephen's remarks, which thank you for focusing on us on that, we're not only in funding this project taking a gamble on whether something will work, which that's what we're here to do, but we're also taking a gamble on the team's expertise to actually execute. Am I understanding what the minority report is saying? It's one thing, and neither of those necessarily would be reasons not to fund it. It just is being clear that if we're taking big bets on important work, there are some questions about the ability of this team to improve the odds. And I just want to make sure I'm interpreting that correctly.
Gil, would you comment on that?
Yes, I think you are interpreting it correctly. I think the only thing I would add is that, you know, if you were to choose to fund this, as I mentioned before, we are going to do everything we can on CIRM's side to support the project and take into account weaknesses and concerns that were brought up by the GWG and try to implement ways in which we can either help the team refine the project, bring them additional expertise as is needed. So it doesn't mean the project is stagnant as you see it, and we can actually, you know, have an impact on what happens post award. So anyway, just wanted to add that. Thank you.
Right, and I just would note that, Fred, that's an excellent question. That this as you know from your time on the GWG and having sat through it over the years, this sort of question comes up in different forms with respect to various applications, particularly, for example, when you have a young investigator that doesn't have a long-standing track record. So it is a factor that needs to be considered for sure. So yes, Mark.
Yeah, just a quick comment. These are terrific questions, and just wanted to share my perspective that when there is a more novel area of science, that risk profile just escalates dramatically, and so the consequences are that it's the chicken and the egg phenomenon in terms of showing the demonstration of, yeah, we can do this kind of approach. Hence the reference to the CIRM conversation previously. So that was what I was more focused on, rather than, you know, the type 1 diabetes patient, and I'm advocating for that constituency. It's more the context of this has also the promise for other areas of exploration as well, and because it is more novel, it then is going to inherently suffer from, you know, concerns and deficiencies about, you know, is it doable or not, right?
Thank you. Fred.
Yeah, so this idea that CIRM as an incubator of good science and an incubator of good researchers, or great science and great researchers, if the staff to whom the burden of shepherding this project through to the best opportunity for success are confident that this team can be supported in a way that helps them execute and utilize these funds in the way that the proposal suggests, then I'm all for it, because it seems like a yes vote on this means we are really burdening the staff with doing what they can do to position this team for the most productive outcome. And I wouldn't want to burden the staff with that responsibility if they didn't have a level of confidence that they would be able to do so and that this team would be receptive to that kind of intervention and support.
Gil, do you want to respond to that?
Well, I can't speak for Rosa's team who would ultimately be responsible for this, but in general, you know, anyone that receives an award from CIRM, we are going to put the same level of work and effort towards. So I think from our perspective, we will welcome whatever the decision of the board is to fund or not to fund.
And I'd add that I wouldn't say burdening is the right question. This is what the team does as a matter of course with our grantees. So this would just be another in the long line of projects which we have that we would be working to help all of the grantees achieve the best results. Anne-Marie.
Yeah, first of all, thank you for all these comments. They are very helpful, at least to me. A quick question for Gil, I guess, is that I now realize that this is already a resubmission. Can you tell us whether they were scored or simply how much progress? Is it significantly better? Were the applicants able to really address the initial concerns? That would help me in supporting them.
So yeah, so the score previously was an 80. So it went from an 80 now to an 84. So it moved up. And from the perspective of reviewers, they did address many of the concerns that were brought up in the original review. There were still additional ones that weren't. I think certainly the feeling that this was overambitious in many respects. The lack of experience may be difficult to overcome in a resubmission necessarily, although I think they did advise, for example, having a type 1 diabetes co-investigator rather than a consultant, meaning, you know, adding somebody who's going to perhaps spend more time with the project than a consultant would. So it did improve from the previous submission.
Thank you, Gil. That's extremely helpful. In my case, I'll support it because I like people that are a little bit overambitious. I'm kidding, but I thought they really, they really made an effort, and what is left there is not easily fixable or can be fixed with additional work, but we're not going to get people with substantially more experience right today. So they'll have to live with that. Great, thank you.
Thank you. Steve.
Yeah, so this is a question of Gil. The preface for this question is that we do have agreements. In our agreements with the grantees, we have milestone provisions, things that they have to meet in order to get the next round of funding, et cetera. Are any of the concerns that got raised in this application, are they addressable by having milestones such that a milestone might be based on what was a perceived weakness in the application, and we control those concerns in that fashion?
It's actually difficult for me to say. I don't think so. I think some of them, such as maybe requiring, you know, a type 1 diabetes expert to be part of the team, is something that could be put in, for example. I think some of the concerns really relate to whether ultimately this is going to work or not. And it kind of falls on the opinion of the scientific reviewers, of some feeling like, let's give it a chance, others thinking, well, maybe I wouldn't give this a chance. So I don't know that kind of element would be addressable in that way, but at least some of them could be.
Thank you, Gil.
Okay, I don't see any other comments here. Seeing none further, do we have any comments by members of the public? Maria?
No, there are no hands raised.
Okay, Hearing that, will you please call the roll? And again, remember, the motion is to elevate this one application to the funding range.
Yes, and that's application number 13163. Dan Bernal,
Aye.
Anne Marie Dulege,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Leandra Clark Harvey,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Rich Lahara,
Yes.
Dave Martin,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette, Jonathan Thomas.
Yes.
The motion carries.
Thank you. Thank you for the robust discussion. I think that was very, very helpful. Are there any other applications currently in the not for funded range that anybody wants to move up to the funding range? Okay, hearing none, then the next, I would like to entertain if this is okay with the board, a motion to approve all of the projects in the funding range, which includes the one just elevated. Do I hear such a motion?
So moved.
I can second.
Thank you. Maria, you got the movers there?
It was Mark and Anne Marie.
Yes, please, Miriam.
Okay. Are there questions and comments by members of the board? Are there any comments from members of the public? Hearing none, Maria, will you please call the roll?
Dan Bernal,
Aye.
Anne Marie Dulege,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Leandra Clark Harvey,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Rich Lahara,
Yes.
Dave Martin,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette, Jonathan Thomas.
Yes,
The motion carries.
thank you. Kevin, I believe we need a motion now to officially close out the not for
Yes.
funded projects. So we need a motion specifically to not fund those projects remaining in the not recommended for funding range. Do I hear such a motion?
I can make this motion.
Thank you, Anne Marie. A second. I'll second. Questions or comments from members of the board? Any comments from members of the public? Hearing none, Maria, will you please call the roll?
Dan Bernal,
Aye.
Anne Marie Dulege,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Leandra Clark Harvey,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Rich Lahara,
Yes.
Dave Martin,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Jonathan Thomas.
Yes,
The motion carries.
thank you, Maria. I believe that is the full package of motions we need on this.
It is.
Thank you. Okay, thank you. That concludes that item. For Beth's sake, why don't we take a 5-minute break? So it's now 10:40. We will reconvene at 10:45. Thank you. Okay, ready to reconvene here. Proceed to the next action item, which is item number 8, consideration of concept plan for EDUC 5 funding opportunity for creating opportunities through membership and partnership across stem cell science with the snazzy acronym of COMPASS. Presentation here will be by Dr. Kelly Shepard. Kelly?
Thank you, Mr. Chair. I'm beginning to share my screen now. Is everybody able to see my screen and hear me?
Yes.
Great. Good morning, or I guess it's approaching afternoon, members of the board, members of the public, and our CIRM team. It is my pleasure to appear before you here today to present a new concept in our education and training program. I'm speaking on behalf of the scientific programs team led by Dr. Rosa Caneta-Viles, but I just want to take a second before I begin to acknowledge that there have been some very valuable contributions from members across CIRM. In particular, I would like to acknowledge Dr. Lila Collins, Haley Lamb, and Gil Sombrano, who all contributed to important ideas and helped us pressure test some of the ideas in this program. With that, let me begin my presentation. I would just like to reiterate, as Dr. Milan presented, our new mission statement, which is our mission is to accelerate world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. We deliver on CIRM's mission by investing in these 5 key pillar programs, which we initiated under Proposition 71 all the way back in 2006. The pillars include, of course, our research and development programs, which are discovery stage or early stage opportunities, as you just recommended for funding in the previous agenda item, our translation stage program, and our clinical and clinical trial stage programs. We also have investments in, of course, infrastructure and education. Education will be the focus of this new concept that I present for you today. As part of our new strategic plan, we will continue to invest in these successful pillars, but build on them by enhancing, organizing, and interconnecting them with one another in order to create synergies and best deliver our mission under Proposition 14. Now, specifically, education and training, this pillar is absolutely core to CIRM's mission and our strategic plan. Dr. Milan presented to you the 3 major themes of our plan, and education and training are actually touching on all 3. In terms of advancing world-class science, trainees, while they're being trained, contribute valuable research and insights that drive scientific progress and innovation. So while they are actually addressing knowledge gaps, they are also receiving on-the-job training while doing so. So part of the workforce of today, as well as the workforce of tomorrow. In terms of delivering world solutions, the training that these programs provide, in addition to their research skills, they are provided with an additional set of skills that they will be able to apply and adapt to meet the challenges of tomorrow, which will be necessary to make the regenerative solutions a reality. And finally, touching on providing opportunity for all, our training programs do target an effort to create a diverse and inclusive workforce in order to bring these valuable and needed perspectives, which are critical to advancing the science, as well as ensuring the fruits of the science benefit all who need it. Of course, these pillars are ultimately part of an ecosystem that we're building to create the workforce that is going to be necessary to deliver on our mission. And this is just laying the groundwork here, but this is where we will go in the course of our strategic plan. We will be creating multiple on-ramps that will synergize with these training programs to help develop the next generation of leaders, scientists, clinicians, and other participants in this workforce. And these training opportunities will be connected and leveraging and enhanced with our programs that support basic research and some of the other pillar programs that you see listed here. So we have already begun laying the groundwork for this ecosystem by refunding our 3 long-term and ongoing training grant programs that were initiated under Proposition 71. But last year, this board relaunched all 3 of these programs with updates and alignments to make them responsive to Proposition 14. These include our SPARK program, or EDUC 3, which supports summer research internships for high school students around the state of California, our Bridges or Edu2 program, which support a variety of programs that train students ranging from later undergraduate stages to post-baccalaureate to master's level programs, specifically targeting California state universities and community colleges. And we have most recently funded a research training program, or Edu4, which supports pre-doctoral, postdoctoral, and clinical fellows who will become future leaders in the regenerative medicine field. So this concept that I'm presenting for you today will join this cadre of our existing programs and complement them and build on them towards achieving that ecosystem that I described. I'd like to introduce for your consideration today a new training program called Compass, or Edu5. As Mr. Chairman already described, creating opportunities through mentorship and partnerships across stem cell science. And I have to credit our president, Dr. Milan, for reverse engineering that wonderful acronym that couldn't be more appropriate. The objectives of the Compass program will be to prepare a diverse cadre of undergraduate students for careers in regenerative medicine. A second objective is to create novel recruitment and support mechanisms that will identify and foster untapped talent within populations that are historically underrepresented in the biomedical sciences. This program will combine hands-on research opportunities with strategic and structured mentorship experiences to enhance the transition of students to successful careers. This program also will foster greater awareness and appreciation of diversity, equity, and inclusion in the trainees, their mentors, and all other program participants. Why are we presenting a new program for you today? What makes it, if I could borrow the term CIRM, which was discussed earlier? There are other undergraduate research training programs in existence, of course, but most of those, even those that are targeting members of underserved communities, actually are looking for individuals that have predefined academic selection credentials, as well as often a stated commitment towards graduate school, medical school, or faculty positions in academia. This program will support the development and implementation of new strategies to recognize and foster untapped talent that can lead to new and valuable perspectives that are specific to the challenges of regenerative medicine. This program will create new paths to a spectrum of careers that are not always apparent to students in the academic undergraduate environment. So certainly paths to those graduate school and medical school positions that we spoke of, but also there's a broad array of other types of careers that build on research skills that are really necessary in order for us to achieve our mission. And this will present pathways to those opportunities for all involved. Finally, this program will be complementary, but not competing with CIRM's Bridges program, which I introduced on the first slide. A subset of the Bridges program do serve undergraduates. However, it's a different but equally important population. So we consider these programs complementary. Similarly, this new program is unlikely to compete for the same pools of students that would be the most likely ones to receive support through the major NIH training programs, such as MARC and the URISE program. So this slide is just a high-level overview of the components of a Compass Award, and I will go through each of these three arms in my next few slides. But basically, a Compass Award consists of three major drives. The first is the outreach and recruitment component, which is how trainees will be identified to be appointed to this program. The second is the experience that the trainee will have when they are appointed as Compass Scholars. And the third is a mentorship program that will be developed and implemented in order to support those students through their time in the program. So let me just go into a little bit more detail about each of those to help you understand. We'll begin with the column on the left, the outreach and recruitment side. So the outreach, each program will have an adaptive outreach and recruitment strategy that will be managed by a dedicated personnel role who will oversee the DEI and recruitment strategy efforts. We'll refer to this individual as a diversity and outreach coordinator. Their responsibilities will be to assess disparities in their own STEM programs within their institution and develop novel and specific recruitment strategies to address and overcome these. Some examples of such strategies could be increased and strategic outreach to underrepresented groups at their university, increased outreach to community colleges, targeting socioeconomically disadvantaged, first in family to attend college, et cetera. We anticipate that they will innovate and create new mechanisms to address disparities and also lower barriers to participation. Their responsibilities are to build and foster and maintain an inclusive and supportive environment through the administration of this program. And the adaptive part is what comes in here on my fourth bullet. They are expected to do regular self-assessments, looking at their own progress, analyzing it, and making adjustments in their strategies as needed. The second component is what a trainee will experience once they have been identified and recruited into this program. So we're proposing that the programs would be developed where the targeted students would be supported for 2 or 3 years per program design. All appointed students would receive foundational coursework in stem cell regenerative medicine related disciplines, principles of translational research, and good research habits, as well as an opportunity to take specialized options per their interest or per program design. For example, things like computational biology or data analysis. All will receive training in soft skills, including presentation and scientific writing. All will have individualized formal mentorship plans and career counseling. All will have opportunities to do paid hands-on research internships in academic or biotech laboratories for 1 or more summer terms or an equivalent period distributed throughout a school year, if that works better for them. All will participate in patient engagement and community outreach activities, a common element to all CIRM training programs. And students will complete a capstone project and present at a conference at a culminating experience. The third and very critical component of a Compass Award is the development and implementation of a mentor plan. This is so important that we've ascribed a dedicated personnel role or mentorship facilitator who will identify and train a small team of individuals that will serve as role models for students and bring cultural awareness, knowledge, and perspectives representing the targeted student groups that may not be present in the resident faculty of the academic institution. They will be responsible for developing those individual development plans for students and assuring appropriate mentorship agreements between the students and their research mentors. They're expected to provide formal mentor training for research advisors and any others who are interacting with the students, including things like implicit bias training. They will be implementing cohort-wide activities to guide the personal and professional growth of trainees, such as life skills workshops, resume interviews, workshops, and networking events. They will provide career counseling and introduce the trainees to the diverse opportunities that are awaiting them for how they can apply the regenerative medicine skill sets in the workforce. And finally, it is their responsibility to assimilate and describe the new mentorship approaches and best practices that they develop and report them and share with other organizations so that the benefits of these can be shared with other institutions that may not necessarily have their own Compass program. So who will be eligible to apply for Compass Awards? We're proposing that this award mechanism be open to California public universities, colleges, or private nonprofit academic institutions that have an accredited bachelor's degree program in biology, bioengineering, biomedical sciences, or really any STEM discipline that's relevant to regenerative medicine. Institutions that intend to host the summer research internships internally, that is at their own institution, must include participating faculty with federal or CIRM supported research programs in regenerative medicine related disciplines. However, applicant institutions that lack this necessary research infrastructure may partner with an external organization, such as a research university or institute, or even an appropriate biotechnology or pharmaceutical company to provide an appropriate internship experience and opportunity for their trainees. I think it's important to emphasize that applicants who do have other STEM-focused undergraduate training programs will be expected to articulate the distinction between programs if they apply for a Compass Award, and also demonstrate their capacity to accommodate a new program without detrimental impacts to any other. And this next slide is to show you the budget that is required to support the Compass Awards. So we will be asking for an allocation of approximately $58 million, which is enough to support 300 to 500 trainees, depending on the lengths of their appointments. The way this budget is structured, I'm just going to briefly go through on the slide below. So assuming an investment of 20 awards with a maximum award amount of $2.91 million, which would be a fully loaded across all budget categories award, each program could support up to 25 students, depending on whether their durations are 2 years, 3 years, or a mixture. The component of the 2.91 million that are directly associated with a per trainee basis is $30,800. This includes stipends for the students, course fees to offset their tuition, research-related funds that go to their internship host lab, and travel to the annual conference. The second component of the budget is the program administration and overhead costs, which is a little over $27,000. This supports the outreach and recruitment efforts, and of course, the mentorship program, developing, implementing, and sharing the results of that. This comes down to a total cost per student per year of $58,220 per year of appointment. In sum, CIRM requests the board approve the proposed EDUC5 Compass program concept with an allocation of $58.22 million to support up to 20 EDUC5 awards, each with an up to 5-year duration at a cost of approximately $2.9 million per award. And that concludes my formal presentation, and I'm happy to take any questions if there are any. Thank you.
Thank you, Kelly, for that excellent presentation and this typically extremely well thought out and detailed new program that you're bringing to the board's attention today. Do we have a motion to approve the requested budgeted amount?
So moved. This is David in San Diego.
Thank you, David. Is there a second?
Second.
Dave Martin.
Dave Martin, second. Questions or comments from members of the board?
I have a quick question for Kelly.
Yes, David.
Do you have any prediction as to, you've got a budget set aside, yes, the 58 million, which is great. Do you have any idea how much of that will actually be absorbed, applied for, and granted?
Well, this is a completely new program,
Right.
and it will be our first time offering it. We're doing this based on, we made some estimates on the number of applications that we thought would be able to apply. Now, not every institution that is eligible to apply would be able to support a full load of trainees as the budget would allow. However, we have based this on comparisons with some of our other training programs, the number of trainees we would like to support. And of course, there's a lot of novelty in that we're asking applicants to come up with innovative mechanisms to bolster untapped talent. And part of this innovation involves learning, trying new things and learning from them and adapting going forward. So we may learn in this first iteration of this program, we may learn a lot that will help us to shape it and craft it in the future, just as we have our other training programs. But we think this is a really good starting point because we have a fairly good idea of the types of institutions that would be interested in applying and their student body populations and what they might be able to support.
Not only do you answer the question clearly and completely, but you take it to the next several steps and you prove that you and the rest of the staff know exactly what you're doing. And I love that.
Thank you.
Okay, we have a number of additional comments. I believe Anne Marie was first, and then we will go down the line here.
Okay, thank you.
I'll be brief. Kudos. So well done, so well thought out, so innovative, so forward thinking, so well presented as well. Appreciate the buzzword, and I'm not joking here, mentorship and diversity. We need that more. People need that more early in their professional life. And we talked about that even earlier today. So my question's a little bit along the lines of what was asked before. I know you cannot predict everything. This is a first step, but in your ideal goal, at least in your goal, how many young undergrads would benefit from this? For how long? Is it a year, 4 years? So that we have a rough idea of really, in the end, the yield in terms of the cost invested versus the number of people that will hopefully be positively impacted by this in terms of undergrad applicants.
Yeah, so we think that we're being ambitious in targeting at least 300 to 500 students. Of course, as some of the discussion alluded to earlier today, there are some challenges that we're trying to overcome. We are trying to create interest and retain interest in individuals coming into schools who might not yet have realized or decided that science, career in regenerative medicine is for them. So this program is going early. It's going to be building these programs that will include a lot of new elements and may take a few years to get going. So I think that programs that already have a lot of experience targeting untapped talent might have elements in place that are ready to go. There are others that might be building. The budgets of these awards, as with our other training awards, the training components are only awarded if students are placed. So if a student is unable, if a program is unable to appoint all their slots, that money will come back to CIRM either at the end of the award, or if they are able to demonstrate to us that they can change things and do better in the next year, they may have an opportunity to carry forward that fund to do that. So I anticipate, as we have with our longstanding programs, which we've indeed had 10, 12 years to learn from, and have gone through multiple RFA cycles, I expect that we will learn a lot from this one as well. In fact, this program incorporates a lot of the lessons we have learned from administering previous training programs. So I'm confident that after the first couple of years, we'll see how we're going with the base that we were hoping to capture. If it's fewer than we're hoping, which is 300 to 500 students, that will tell us that we need to do more, and we need to ask these programs to do more, and we can course correct alongside them. Thank you. Thank you for that question. Did I answer it sufficiently, or is there more?
Yes, very much so. Thank you.
Oh, thank you.
Haifa, please.
Thank you, Kelly. I echo the same sentiments. I think this is a great program. And my question to you, Kelly, is how CIRM going to advertise for this amongst different institutions to make sure there is a broad outreach? And for those institutions that have probably robust candidates, but they don't have capabilities to mentor, and they would like to collaborate with other institutions, how's CIRM going to help with that as well?
Thank you very much. So we've been thinking about that as well. And we have a communications team that has a number of new members that are very savvy and have some new ideas about how we can do that. But one way we do is we have a pretty firm connection with the investigators that do have the major research infrastructure in those institutions. So one side of the coin is working with them to make sure they're doing the appropriate outreach that we expect of them, speaking to other organizations and finding ways to support them. That's one side of the coin. The other side of the coin is making this opportunity, raising awareness about it to the institutions that might benefit from it, and educating them that they may be able to apply if they are able to form partnerships. Part of that outreach will be through our communications plan, and my effort. I have various contacts through administration of the Bridges program with Cal State universities, community colleges. We have contacts within those systems who can share the word within those organizations. So we will do we will do an outreach blitz to make aware. But I believe that we will be able to also, once we are able to post the program announcement, have some kind of a webinar or information session that we will personally, our programs team will be involved in to make, to educate and aware. And that is something that we would be able to record so it could be shared and other people could visit and watch it and learn if they're unable to attend a live webinar.
Okay, thank you.
Steve, you were next.
Yeah, so my first question is predicated on the assumption that this is a brand new program that, and I'm not even aware that any other institution has anything like this. So the first question really is, who's going to make the assessment of who can participate as an institution or not? Where is the knowledge base of reviewers that would say that this application is a good application and this one isn't? Who do you intend those people to be?
The actual decisions as to the merit of an application, including the institution and what they can bring to the table, that is the topic of the grants working group discussion. And so the review criteria that we will ask them to use to evaluate these proposals will factor in a lot of those things that you're concerned about. And indeed, with our experience with the Bridges program, all of those students also work in a host lab, which is a partnering institution. And part of the review of that process is looking at the different host institutions and agreements that have been created in putting together the application and whether they represent appropriate opportunities. The grants working group who review our training programs include experts in stem cell biology and regenerative medicine, but they also include experts in education and delivering education, including those who have expertise in mentoring and outreach. And of course, diversity, equity, inclusion is a critical component of this program. And we do have expertise on our grants working group that can speak to that, or if we need more in specific areas, they can be recruited for the review. So basically, what the short answer is that we will ask experts from the grants working group who do have the kind of expertise to evaluate both the scientific elements of what will be offered to the trainees, as well as the mechanics of the mentorship and recruitment strategies, and whether or not they'll deliver on what they're asking them to do.
Well, I accept what you said, except that, you know, over the years in reviewing the biographies of grants working group members, of which there have been a number, I don't recall too many, if any at all, that speak to their ability, you know, to judge educational, enterprises, et cetera. So hence my question, you know, for the most part, our GWG members are very steeped in science, but not so much in this sort of work. And so I just want to make sure we have people who, you know, understand how this works, making these judgments, which goes to the second question. So this is a large rollout, you know, $58 million, 20 institutions, that's the upper limit. Oftentimes when you're doing something that's very new and different, you start with a pilot program, something a little smaller, you get your hands around and make sure that you've got, you know, it's working the way you want it to before you decide to roll it out larger. So I just wondered if you had considered starting smaller, you know, for the first year or two, making sure you've got this thing working before you decide to go broad.
Yes, indeed, we had considered that, and our leadership team discussed a number of options. And ultimately, I believe, and I don't want to speak on behalf of them, if Dr. Milan, if you want to address this, but ultimately, it is a pilot program, and the way we intend to administer it is the rollout, the payments and funds are structured in such a way that there will be milestones where they demonstrate that the pieces, if it's a completely new program, that the pieces that need to be built come into place as the programs ramp up. And as I mentioned, the de-risking of the fact that certain components of the award aren't paid if the trainees aren't appointed, we feel is something that de-risks this to operate it in this way. And we also have many new components coming together that we would like to factor into this as we learn and as we go. So I'm not sure if that completely addresses your second question, and I will give Dr. Milan or anybody else who would like to speak to that an opportunity to say that. But I also, to your first question, we have a number of GWG that are specialized for education that really only participate on our training grant reviews. And they're not exactly the same as the ones you hear about reviewing most of our programs. And there were a number of new ones appointed just last year that participated in our review. And I don't know if Dr. Sombrano wants to speak to that, but if there are, that came up earlier, and there we can always our review office can always recruit more and additional expertise as needed. And we do think that weighing in on the DEI component and the outreach components and the mentorship programs of this program are key to making it successful.
All right, well, just one final point, unless Dr. Milan has something to say, which is, given all of this, I think it would be useful, at least this is a suggestion on my part, that let's say after a year or so of having got this thing up and running, that the board hears back about how things are going, what you've been able to do, and how things are proceeding. You know, that we know that this is going in a forward direction.
I think that's a wonderful idea, and I'm always happy to come and tell you about how the results are in real time of the concepts and programs that you have weighed in on and approved ultimately and made your recommendations. So I'd be very happy to do that.
Thank you.
Thank you. Thank you, Steve, for all your comments. Isabel, you're next.
Thank you, Mr. Chair, and thank you to Steve for his questions. Those are really important ones. Kelly, great. Congratulations. I love this. It speaks to my earlier fears and concerns, although it's going to be a while to move those kids through pipelines, but it is a pathway. And I really appreciate that CIRM is thinking about this. to an earlier point that Art made and may want to make again with the affirmative action issue at the Supreme Court. One, are you thinking about how you might have to quickly pivot or be more nimble in the next months ahead to respond? But also, I heard you say one thing, I hadn't seen it, but I'm glad you mentioned community colleges, because I think that that may also be a missed opportunity if we don't reach into those institutions who I believe are actually trying to build up their science programs to get young students started early and to seed that kind of belief and ability to do science and to build a career on that. So I'm glad to hear you're doing that. But to the question, have you thought through how you might have to pivot and respond should the Supreme Court take what I would consider a negative action against affirmative action?
Yeah, so that has only come up, recently since we put together this concept. But of course, we've always had to deal with Proposition 209 and the restrictions around that in this state. And we know that we aren't allowed to target specific ethnicities or races in making funding decisions. However, we feel that by having programs assess gaps and come up with specific outreach strategies to target them is a good way to go, because we believe that this is actually addressing a scientific challenge. It's not increasing diversity and perspectives is important for many different reasons, but CIRM is ultimately interested in developing cures, and having those perspectives it's critical to advancing the science, because these perspectives open up lines of investigation and questioning that might not have been considering by somebody else's limited perspective. And so we see this as a way to address a scientific review criteria inside and outside of anything focused specifically on diversifying. So those goals are parallel, but they're the same in a way. So we are thinking about that, and we will certainly keep a close eye on any decisions and whether or not that affects the way we need to do that. But we are specifically allowed to target socioeconomically disadvantaged and similar first generation in college. And we have a lot of benchmarks that we can look at that we think will be able to help us try to navigate around any new challenges that might present themselves within the next year or so. So it's hard for me to know exactly how we would address something, not knowing what new obstacle might come our way, but we are fully prepared to do whatever we can to find workarounds that will allow us to do this.
Well, thank you, and best be prepared for anything, I guess, but I'm glad you basically have some experience around it, just dealing with 209. Thank you.
Mm-hmm. Thank you.
Thank you, Isabel. Art, you're next.
These four programs, but the previous three, Bridges, Spark, have been instrumental in bringing a diverse group of young people from the state university system, community colleges, and high schools into the mix. And I think we're doing more than the University of California is in recruitment of these young people from diverse backgrounds and socioeconomic backgrounds that have been underserved. And let's keep in mind the CIRM Scholar Program, one of our biggest graduates was Derek Rossi, the co-founder of Moderna. So we've made an effort in terms of reaching out to young scientists with that CIRM Scholar Program. But again, it comes back to what Steve stated very eloquently, and that is review and overview and follow-up. And I think that's been important because I know Gil and Maria and others who have been working on this, Kelly especially, always recognizing that we need to find out where these kids land up. And you'd be surprised of how impressive positions many of these people, especially in the Bridges program, have landed over the years in terms of the sciences and in terms of research, not only in California, but clearly across the country. And speaking of community colleges, there was a recent law passed in 2014 that allows us to provide for 4-year bachelor's degrees at community colleges. Well, one of those programs is very important to us, which I've been working with Shyam Patel and others on our staff, and that is the biomanufacturing major offered at Solano College, right near UC south of Davis, and in San Diego, the Miracosta College, where four-year graduate programs are being provided with a full baccalaureate at much less expense, especially in biomanufacturing, which is going to be a challenge for us. So Maria and I have been working on that, Milan have been working on that for some time. And again, it's these kinds of recruitment programs, these kinds of resources that we're providing is the future, and the future for biotech, bioscience, and clearly for patients. Thank you.
Thank you, Art. Leandra?
Yes, thank you. I definitely agree with the comments that were just made by Art regarding, the follow-up and the follow-through and just really looking at where people end up. I think that's wonderful data to collect. I don't think enough people do that. So, and I also want to agree with the comments that Isabel just made and the question she had. I think outreach obviously is so important, and I really would encourage thinking kind of outside of the typical recruitment and outreach box that we've utilized for so long, especially in this digital age. So, social media, and then also looking at, who you can bring on as ambassadors from community-based organizations or folks that represent the people that we're targeting to spread the message, to get the information out there, I think are things to continue to think about doing. Things are changing so quickly in communication, particularly now that we're in a pandemic. So our typical kind of job fair model or emailing or that type of thing, it's not as effective. So just wanted to definitely encourage that in order to reach people.
Thank you very much for that suggestion. I learned a lot about this as well in doing the research to put together this concept, because I brought it, we, our team, we brought in perspectives that we didn't have at CIRM, including we did speak to a community organizer and some others who are involved, and we certainly learned a lot, and it helped inform the development of the concept, but our learning doesn't stop there. We want to continue the dialogue and bring in new perspectives and evolve and make these programs the best they can possibly be. So thank you very much for that suggestion, and we will continue to try to do more of that. Thank you.
Dave Martin?
Just very quickly, Kelly, that sounds very exciting. I urge, while I think of and have an opportunity, I urge you and Dr. Milan and Isabel, actually, if you haven't, to look very quickly and carefully at an organization called Summer Search. It's a national organization. It's very active in California, and it will really help this program.
Thank you very much for that suggestion. I will do that immediately after this meeting is concluded.
Any other comments by members of the board? Any other comments from the public? Maria?
There are no comments.
Okay, thank you. Again, Kelly, thank you very much. I have one last question for you, which is this is this latest program sort of fills in one of the few interstices between the various programs that we have. Do you anticipate that there will be any other edu programs coming down the pike? And if so, what might they be?
Well, part of our strategic plan includes bolstering and investing in these pillars, but also creating additional types of on-ramps by leverages through our other programs that are existing, but also in development. So we have some preliminary plans laid out over the next few years for the first things that will roll out. And you'll see, I don't have specifics at this time, but I think you will see that there will be continue to be build in workforce development, because as good as these programs are, there are still some areas that we think are important for delivering in the future, especially at stages that are, in disciplines and specialties that are not necessarily the ones that are introduced to students during their undergraduate educations in the academic environment. So building connections through those organizations that do have that kind of training and hooking them up and into these programs. I think it's fair to say that you will see more types of training opportunities in the future, but as to whether it would be an EDUC6 or come in under the guise of one of our other programs, that is something that the LT and the strategic plan will formulate over the next couple of years.
Thank you. Dr. Milan.
Yeah, I just want to clarify that for sure, with the addition of this new program, we cover a lot of ground. So I think there's a lot we can work with in terms of leveraging these education programs for some of our other objectives. But as of now, there's nothing planned for another concept, at least in the next year. This is a really big piece of it. We just, educational programs have been the largest investment in these since the passage of Prop 14. And we wanted to do that early because we wanted to get things going, because as Isabel noted, it's going to take a little while, and the need is here today. But I do feel that with the addition of this new program, this takes care of the various on-ramps, and I think that we have a lot to work with. Thank you.
Thank you. Okay, Maria, will you please call the roll?
Haifa Abdulhak,
Yes.
Jan Bernal,
Aye.
George Blumenthal,
Yes.
Michael Botchin, Linda Boxer,
Yes.
Leandra Clark Harvey,
Yes.
Anne Marie Dulege,
Yes.
Isabel Duron,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Elena Flowers, Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
James Kovach,
Yes.
Rich Lahara,
Yes.
Pat Levitt,
Yes.
David Lowe,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Christine Miaskowski, Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Roulette, Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Bori,
Yes.
Carol Watson,
Yes.
Keith Yamamoto. Barry, are you on the line? Okay, the motion carries.
Thank you. Thank you to Kelly and all of your team. Another expertly thought out program, and we look forward to implementation. Thank you very much.
Thank you all very much as well.
Actually, JT, if you don't mind, I have a quick question. I was just thinking about our discussion. I often get requests or questions from young people who are looking for mentorship in biotechnology in general. And I was wondering if someone at CIRM could send us an email with who we should connect them at CIRM to answer the question. These are usually either undergrads or shortly after grad. And to some extent, if any of you have those resources, I just looked at Summer Search, which is in fact fantastic. Could we have a list of those website organizations that can help young people we want to mentor? So thank you so much.
Thank you.
Thank you, Anne Marie. Okay, on to the next item. Another. Ooh, kind of an echo there. On to another concept plan, which is consideration of the concept plan for infrastructure for funding opportunity for Alpha Clinic network expansion. And we will have a presentation here from Jeff Lomax.
Great, thank you very much. I'm just going to, thank you. That's the title slide. So I'm going to move to my presentation. Bear with me one moment. Very good. Thank you, Chairman Thomas and Vice Chairman Torres. Good morning. My name is Jeff Lomax. I'm a senior officer with the Therapeutics and Development team at CIRM. I will be presenting the concept plan for the CIRM's clinical trials network, known as the Alpha Clinics Network. Referencing Dr. Shepard's presentation, the network lives in CIRM's infrastructure pillar. And I had the opportunity to work under Dr. Milan's leadership to launch the network in 2014, and subsequently have served in a project management role for the network over the past 4 years. Next slide, please. So CIRM's mission of accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and the world In the context of our mission statement, the Alpha Clinics Network is the place where treatments reach the patient. The network is focused on the delivery of clinical trials, and I'll provide some additional program metrics in my presentation to illustrate this point. Next slide, please. So the Alpha Clinics Network currently includes 6 medical centers across California. These centers provide a set of core capacities necessary for the delivery of regenerative medicine treatments to patients. Examples of these capacities include the ability to do advanced stem cell and gene therapy clinical research and clinical trials, a dedicated focus on patient-centered care, so educating, informing, consenting the patients to these trials, supporting CIRM's workforce training and community outreach objectives, and I'll give an example, a specific example of community outreach work that was done, facilitated through the network. And fundamentally to accelerate CIRM's cell and gene therapy, both the clinical pipeline and clinical trials. Next slide, please. So since 2014, we've gathered some metrics from the program, and fundamentally with the aim of, again, the aim of enabling innovative clinical research. So we've invested 40 million in the initial rounds, and that's supported a tremendous increase in access to patients to clinical trials. There's been over 105 clinical trials since 2015. 82 of these trials are actually trials that have come in from industry or academic sponsors without any support from CIRM. A smaller fraction, 23, are CIRM-funded academic or industry trials that have been supported through the CLIN2 award mechanism. And 15 of these programs are actually open at multiple sites in the network. And I'll explain how the networks work to open multi-site trials, some of the tools they've put in place. They've secured 95 million in contracts to support some of the trials referenced above. And in terms of training, the programs at UC Davis and UC San Francisco, they came in a little bit later. They came in in 2017. So they're the 2 programs that have formal training programs. They've trained 11 MD fellows around clinical trial regenerative medicine. So a lot of training around trial design, delivery techniques, everything a trainee would need to know to be able to work in the field. Next slide, please. So starting in 2015, as the program rolled out, CIRM worked in partnership with the network sites to develop tools and resources that would attract commercial sponsors and accelerate clinical trials. They include a common intake process for sponsors, so we can introduce sponsors to the network and work to identify the best site for their program or sites. Cohort identification tools that leverage patient registries that many of these medical centers have access to. We developed an Irb Reliance Agreement, which allows a single IRB to review a protocol and then additional sites to base their approval on that, or base their opening of a trial on that approval. And based on 2008, around 2018, in progress reports, Reliance sites that were using the primary IRB's approval reported a 60-day, being able to get trials up and running in about 60 days, which is, or less than 60 days, which is really, as a marker, really, that's a tremendous amount of efficiency. There's also been rapid approval of compassionate use protocols because of this connectivity between the institutional review boards, primarily in the oncology space. There's been collaborative treatment protocols between multiple sites where a particular trial site may not have the capacity to run the trial independently, but through networking with different sites, they've been able to run protocols. And in general, there's a wide degree of sharing of both regulatory knowledge and knowledge in regenerative medicine in general, vis-a-vis monthly calls. And perhaps my favorite is illustrated by the picture here. This is the our last in-person network symposium where we come together, and it's really a wonderful opportunity where patients, principal investigators, and other teams associated with the network really describe their journey in the regenerative medicine space, animated always by the patient experience. And so it's a terrific event. Hopefully we'll get back to those soon. Next slide, please. So in the previous slide, I touched on some of the tools and resources developed by the network, but CIRM, in collaboration with our partners, has developed a number of manuscripts and publications that really elaborate further on the tools and core competencies related to patient navigation, clinical trial delivery, workforce training, and other aspects of regenerative medicine, and be happy to share any of these publications with you. Just feel free to ask us. Next slide, please. So earlier I indicated I would describe how the network has served CIRM's community outreach objectives. So I'd like to provide an example in the context of our COVID-19 program. This particular example, City of Hope, UC Irvine, and UC San Diego collaborated to expand recruitment in the context of a convalescent plasma research study. In particular, the sites were interested in ensuring representation from medically underserved populations. So using census data, they were able to look at the patient population that was presenting in the clinic with COVID, and then take that population and perform an analysis where they were overlay census data, that indicates where medically underserved populations reside. They were able to extract down to the zip code level to inform recruitment strategies to attract a diverse donor population from these areas. The results were that 76 patients, or 44% of the overall study population, lived in medically underserved areas. And it really demonstrates how the network can deploy tools combining medical and demographic data to support diversity. This approach has been published, so it's in the peer review literature, and the capacity is now conserved among network partners and can be replicated in future studies. Next slide, please. So the network is fundamentally an investment in teams that bring regenerative medicine expertise. These teams support the unique aspects of regenerative medicine trials, things like apheresis and knowing how to treat patients with the types of technologies we're deploying, product processing, biospecimen management, and pharmacy, the sort of technical aspects. All the sites have some level of GMP capacity. Regulatory support, it's been a big part of the network and a big part of the networking. And really, again, a training platform for all the activities above. And one of the great opportunities I was able to participate in was in August 2018, two-day workshop that City of Hope coordinated in collaboration with all the network partners to introduce nurses, focused on nurses, and introduce them both to research nursing and nursing and regenerative medicine. And there were over 150 attendees. 56% of those attendees were registered nurses. So next slide, please. So as we move forward with our 2022 strategic plan, there is an ongoing need for the capacities provided by the network. There's with the expanding number of clinical trials, the need for this expertise is growing. There's a continuing need to develop the workforce in size and diversity to address gaps in the growing number of regenerative medicine clinical trials. And there's a need for clinical competency hubs to support the statewide development of patient care capacity and addressing the diverse needs of California patients. So with that, I'd like to transition to the next slide where I'll introduce the concept proposal we are bringing forward for your consideration today. This is a proposal to expand the network. The proposed budget is $80 million. It would be open to California medical centers. Individual awards would be $8 million for a 5-year period. Priority would be given to applications that offer matching funds or in-kind support. This is criteria that's spelled out in Proposition 14. And the applicants would be required to propose a combination of required and unique offerings. So at the highest level, I referred to the figure at the right. The RFA can be viewed as having 3 core elements. In terms of eligibility, again, the applicant must have a track record in supporting cell and gene therapy clinical trials. So that is really the eligibility, who's eligible. The second part would be applicants must propose a training program to support regenerative medicine clinical research and care. And I'll elaborate on that on point 2 in a moment. And third, applicants must propose lead offerings or lead offering or lead offerings that can be shared among the network partners. So really build the networking and the synergy. And proposals should be responsive to CIRM's requirements regarding patient access, data sharing, and DEI. Next slide, please. So I'm now turning to requirement number 2, again, which would be mandatory for all applicants. A major CIRM strategic theme is to provide opportunity for all. And this really reflects the training, CIRM training at the clinical level, the clinical stage training. And so strategies for building a diverse and skilled workforce are incorporated, at all levels of our programs. In this case, we would ask applicants would have the opportunity to propose training programs within one or more of the competencies areas necessary to support clinical research. So I mentioned earlier, there's a lot of interest in nursing. We have a track record in physician training and the fellows programs. Research coordinator, this is a position actually that's widely supported in all of the awards, and it came up during the strategic planning process that this is a challenging role to fill, and we agree and we know it's necessary in this context. So that's specifically called out. Stem cell pharmacy and patient navigation are all areas that would be eligible as where applicants could propose training programs. Next slide, please. Requirement number 3, in terms of lead offerings, there were a range of clinical research needs and opportunities identified in the strategic planning process that could enhance the field of regenerative medicine. Many of these opportunities, such as consortia and novel clinical trial design, were suggested by our stakeholders and are reflected in the strategic plan. And we know many of the medical centers in California have the capacity to support these types of activities and advanced stem cell and gene therapy in general. So I've sort of categorized them in sort of 3 areas here, and we anticipate applicants will provide a range of lead offerings that support the overall growth of the field. Next slide, please. So a network by definition should create synergy, and we already have a number of examples where multiple sites have partnered to deliver treatments that were beyond the capacity of any one individual site. The RFA encourages applicants to provide specific examples of how they will both create synergy and consider how they will partner with medical centers across California. And applicants are aware these plans should be developed in light of CIRM's mission. And in the context of the RFA, applicants will be, will be given the opportunity to propose partnerships in line with our strategic plan. Next slide, please. And finally, this is something a little bit new to this RFA, which would be organizational integration plans. Applicants will be expected to describe in the form of a business and organizational integration plan how they aim to leverage proposed capacities and capabilities so they become integral to the center's operation beyond the award period. So this is really an opportunity to sort of embed these operations into the long-term operation of the medical center. We expect these plans would be, they would initially submit plans at the application period, but these would be living plans that should be revised over the award period as capabilities and capacities within the network evolve. And in addition, the plan may describe operational synergies between the Alpha Clinics network sites and other CIRM programs in general. So with that, I'm going to stop. I think my last slide is just the intro slide again, and happy to take questions from the board.
Thank you very much, Jeff, for this excellent presentation. I think by all measures, the Alpha Clinic network concept, when we originally put it into play, which at the time was a first of its kind and remains that way, has been a great success. And I think this is a compelling description of the need to expand it, to give it the opportunity to further that success above and beyond. Do we have a motion to approve the budget as recommended by Jeff?
So moved. David, San Diego.
And
Thank
I
you.
second, or anyone?
Seconded by Anne Marie. Questions and comments from members of the board? I see Anne Marie, then Steve.
Women's first?
Anne Marie.
Tony, at some point it will have to be men's first because you won't be so outnumbered. But first, congrats, really congrats. Well thought out, well presented, high caliber, visionary. It's really so impressive, and what a pleasure and what an honor to be part of this endeavor in our capacity. My only question is, how do you regularly evaluate the quality of the work being done? And do you have examples where you had either to frankly course correct a previous Alpha clinic, or at times potentially discontinue one of them?
Well, we haven't, none of the awards were discontinued. What we routinely collected twice annually were reports on the number of active clinical trials, the number of patients treated. And so what we were able to, as long as we were able to see that they were both increasing in the number of trials and within those trials, meeting patient recruitment objectives. So those have typically, those were our sort of core metrics during the early years of the program. Then obviously we added that they had to meet their training objectives. That was the Davis and San Francisco site. So that's how we were able to kind of check those. And then also with the Davis and San Francisco programs, when they started, we had moved over to our milestone-based awards. And so they had, their milestones were based on increasing the number of clinical trials in a sort of sustained way. And both of those sites greatly exceeded the number of clinical trials that were specified in their milestones. So those
Jeff,
to date.
May I just add to that if you were wrapping up?
Yes,
Sorry.
please.
So in addition, we actually measured efficiencies such as time to contracting, time to site, to the clinical trial launch, things like that. And also we were able to track how often the sites were able to expand their activities beyond their own site, because there, as Jeff had presented, shared IRBs, et cetera. So what happens is it's an automatic place in terms of additional clinical trial sites and follow-up sites. So those are the things that Jeff has been following in the course of the normal management of the awards. So we will be continuing to do that, but also adding additional metrics to formally follow. Thank you, Jeff. I really wanted to highlight all the amazing things you've been doing. It's sometimes difficult to remember all of that.
A very, very quick response to that, if you don't mind. All what you said is important, but I'm sure that at some point someone is checking the quality of not just the intensity or the spectrum, the breadth, by measuring protocol deviations and generally GCP types of qualities. It is maybe something you have delegated to the CRO, but I'm sure that I assume you keep track of this or an oversight on that, purely the quality of when patients are enrolled in a trial.
So Dr. Deliege has an excellent point. And in fact, those are informally collected and followed and tracked. But as we are developing, Dr. Creasy heads the therapeutics development program, this whole concept of knowledge networks, even in clinical trial research, in terms of not just the scientific data, but those components are in her sights in terms of what the team plans to do. Thank you very much.
And Maria, please call me Anne-Marie, not Dr. Juliet. That makes me uncomfortable.
Is it because of how I pronounce your name?
No, it's just because
I'm far away
married
from
to everyone here.
French.
No, it's not about
that.
Okay, thank you, Steve.
Yes, I'd like to go to slide 8, please, if you would, just for some clarification. No, it's not. I'm sorry, slide 10. So $80 million budget, $8 million maximum award. So I take it we're talking about a maximum of 10 centers. Is that right?
Correct.
And of those 10 centers, the 5 existing ones that you showed on the map of California earlier on in the presentation, are they eligible for an up to $8 million award for 5 years as well?
Based on the current concept proposal, yes. And there are actually 6 medical centers within 5 awards. So the UCLA and UC Irvine are a combined award. So that's a little bit nuanced there.
All right. So assuming that they all apply, assuming they're all awarded up to 8 million, which would seem a reasonable assumption, we're looking at the potential of up to 5 new centers then. Would that be a clear inference?
Yes.
All right. Thank you, Jeff.
Okay, Fred, then Haifa.
Okay. So thanks for this. I'm wondering how this program fits into the larger ecosystem of centers that run clinical trials. For example, in ALS, there are 8 certified treatment centers of excellence, which is where all clinical trials for ALS go. And a few of them are among those that are already part of this program. And so I think it would be helpful on some level to understand sort of the intersection that these clinics don't actually operate in silos. Certainly the patient community does not exist in a stem cell silo versus a small molecule silo. And so when we're thinking about this, I'm hoping that we're thinking about how this fits into, how this leverages the existing clinical research sites for various diseases, but I'm the ALS and MS advocate, so ALS is certainly the sphere I'm most familiar with. We fund 8 of those certified centers. California has more of those, probably twice as many as any other state. So when we're looking at this program, it would be really helpful to think about how it fits into these sites, because they're doing more than just stem cell research. If we're talking about leveraging the philanthropic dollars or other funding that goes into supporting these clinics rather than for specific approaches like this is, as opposed to specific diseases like ours are, and just kind of how that whole thing fits together, or at least have sensitivity and vision around how all those pieces fit together in a way where the assets are leveraged.
Yeah, so
Jeff, do you want me to take this?
Sure, go ahead.
And then you could add. So that is absolutely the case. And so this program has been in place now for 6 years, right, Jeff? And what has happened is it's leveraged other programs such as the CTSA, as well as comprehensive cancer centers of excellence. What happens is those are all kind of embedded and it leverages all of those assets. And it could be actually that some of the trials that you've described are also already interconnected via those networks. And another example is our Cure Sickle Cell initiative with the NHLBI, that is an NIH CIRM partnership, but it's using the Alpha Clinic sites. So it allows for this multiplex partnership. And so it is not at all restrictive. And in fact, it augments the other the other efforts going into joint efforts and collaborative efforts. But we can go in, but I think what we could do, to your point, is maybe take a look at how take some base cases and examine how these particular efforts intertwine and how they, what that looks like in terms of activity flow and all that. And that'll be something that we'll bear in mind as we report back on these programs. So thank you. And then Jeff, I didn't want to interrupt, but I wanted to make that point. Thanks.
Yeah, thank you for adding that. And thank you for that question. Really, I mean, my way of looking at this is, to the extent cell and gene therapy opportunities emerge within those disease areas, this is kind of the A team, the rapid response team. So in the context of ALS specifically, I alluded to this in my presentation, the network did support the Brainstorm trial, and it was a pretty unique collaboration leveraging the ALS clinic at UC Irvine and the manufacturing facility at City of Hope. So in the context of ALS specifically, because of the nature of that award, the Alpha Clinics Network was extremely well positioned to run that quickly and efficiently. And that's in fact what happened, and that partnership emerged in the context of that trial, specifically in ALS. So I think that's one example of how it's be able to quickly leverage existing assets.
I think I'd also just point out that Cedars-Sinai, that has received CIRM funding for their stem cell program, was also a Brainstorm site, as I think was CPMC in San Francisco. So, how we do this in a less fragmented way, where we're getting the resources to the folks that are actually doing the work. I hope we see that as we go forward.
Thank you. Haifa?
Thank you, Jeff, for a great presentation. Do we have data on the presentations, publications, and INDs probably that came out of the Alpha Clinics?
Those are in progress reports. It would take a bit of, I've not been able to sort of sift them into a, say, tabular form. I apologize for that, but we do have those reports. The publications are, very impressive, and we could come back with, more information on that, but I don't have it at my fingertips.
Thank you.
Any other comments from members of the board?
Sorry.
I would like to make a extremely minor friendly amendment to the motion, which instead of going straight to approving the budget, the motion should be to approve the concept proposal, which includes the budget. Are the mover and second, are you amenable to that very minor friendly amendment? Anne Marie, I think you were the mover, as I recall.
It was David and Anne Marie.
David and Anne Marie.
Yes, of course.
Okay, thank you.
Yes, fine with me. Yes, definitely.
Thank you. Comments from members of the public? Hearing none. Maria, will you please call the roll?
Yes. Give me 1 second to bring up the roll call for. Haifa Abdullah.
Yes.
Dan Bernal.
Aye.
George Blumenthal.
Yes.
Linda Boxer. Leandra Clark Harvey.
Yes.
Anne Marie Dulage.
Yes.
Isabel Dudon.
Yes.
Mark Fisher Colbury.
Yes.
Fred Fisher,
Yes.
Elena Flowers, Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Jim Kovach,
Yes.
Rich Lahara,
Yes.
Pat Levitt,
Yes.
David Lowe,
Yes.
Linda Malkus,
Yes.
Dave Martin, Shlomo Melmed,
Yes.
Christine Muskowski, Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette, Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson,
Yes.
Keith Yamamoto.
Yes.
Thank you. The motion carries.
Thank you, and thank you, Jeff, and team for your excellent work. This is a fantastic program that will only get better with the addition of more participants. So thank you. Members of the board, we have a few items left. None of these are looking to be very time consuming. I don't think we need a break for lunch. Is everybody comfortable with just sort of proceeding apace here and working through the remaining items? Or does anybody have an issue with that? Let me put it that way. Okay, hearing none. I wanted to ask Beth if I'm sorry, Maria, sorry.
Oh, I wasn't speaking.
Oh, let's see. Michael, did you have your hand raised there? No.
No, just give me a thumbs up.
Oh, a thumbs up. Okay. Thank you. Beth, do you need a break or are you good to go here?
I'm good, Mr. Chairman. Thank you.
Okay, very good. We'll proceed along then. Item 10, consideration of conflict of interest policy for the scientific advisory panels. Kevin.
Thank you, Mr. Chairman. This should be a quick item. As the board is aware, Proposition 14 authorizes the chair and president to establish advisory task forces to provide expert guidance regarding specific issues within CIRM's jurisdiction. For the purposes of conflict interest rules, advisory task force are to be treated like working groups. And accordingly, the board is required to adopt conflict of interest rules to govern these task forces. On January 21st, the board adopted an interim conflict of interest policy for the members of the advisory task force. That interim regulation has been in place for quite some time. In April of 2021, we began the first official rulemaking process by submitting the notice to the Office of Administrative Law. At that point, CIRM received no public comments during the comment period. Upon further review of the draft regulation, we noticed it needed a slight modification to ensure that it was clear that advisory task forces are authorized only to make recommendations to the ICOC and that they have no distinct decision-making authority. Those changes were made, and on November 23rd, the CIRM staff began a second round of formal rulemaking process. There were no comments received from the public. As a result, the recommendation is for the board to approve the proposed regulation, which is attached to the backside of this memo in its current form. Thank you, and I'll take any questions.
Thank you, Kevin. Is there a motion to approve?
So moved.
Is there a second?
I'll second.
Thank you. Questions, comments from members of the board? I don't see any there. Any questions or comments from members of the public? Maria?
No, there are not.
Okay. Hearing none, Maria, will you please call the roll?
Yes.
Aye.
George Blumenthal,
Yes.
Linda Boxer, Leander Clark Harvey,
Yes.
Henry Dulage,
Yes.
Isabel Dudon.
Yes, Maria, I think we're having problems hearing you just a tad.
Sorry.
Yes.
Kevin, can you mute yourself? Thank Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Elena Flowers, Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Jim Kovach,
Yes.
Lahara,
Yes.
Pat Levitt,
Yes.
David Lowe,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Malmed,
Yes.
Christine Miskowski, Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Al Rolette, Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson, Keith Yamamoto. Motion carries.
Thank you. Item 11, consideration of accessibility and affordability working group bylaws and confidentiality policy. Kevin.
Thank you, Mr. Chairman. Again, for the ease and the efficiency of time, we'll work through this PowerPoint pretty quickly. So for the board's information, the AAWG is one of the 4 working groups that were created collectively by Proposition 71 and Proposition 14. The board's previous desire was to have similarities between the bylaws of all the working groups where applicable. So therefore, this draft was created pursuant to that philosophy. Since Proposition 14 articulates much of what is the mandate for the AAWG, the bylaws follow that mandate pretty closely. These draft bylaws were presented to the AAWG on December 1st, and with one addition that we will go through quickly, was recommended for the board adoption. As you can see on the subsequent slide, there's an articulation of the highlights of what the, if you can move to the next slide, please. There's an articulation of what the bylaws themselves state. The bylaws are also attached as another document here for the specifics. The one change to highlight was with Article 4, Section 16. During the conversation of the AAWG, there was a proposal that the AAWG have the ability to create subcommittees to work in smaller groups and have those subcommittees make recommendations to the entire AAWG. So they have therefore been incorporated into the bylaws. Also, as a part of the bylaws is the confidentiality policy, which is in Appendix A. That also is consistent with the confidentiality policies that we have in place for each of our working groups. So with that, absent any questions, we recommend that the board therefore adopt the bylaws for the AAWG.
Thank you, Kevin. Do we have a motion to that effect?
Happy to move.
So moved.
I think we'll give Anne Marie the motion and Mark Fisher Colbury the second, if I heard that correctly. Is there any question or comments from members of the board? Any comments from members of the public? Hearing none. Maria, will you please call the roll?
Abdullah,
Yes.
Dan Bernal,
Aye.
George Blumenthal,
Yes.
Leander Clark Harvey,
Yes.
Anne Marie Dulage,
Yes.
Isabel Dudon,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
Jim Kovach,
Yes.
Rich Lahara,
Yes.
Pat Levitt,
Yes.
David Lowe,
Yes.
Linda Malkus,
Yes.
David Martin,
Yes.
Shlomo Melmed,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta.
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Art Torres,
Aye.
Christina Vori,
Yes.
Carol Watson, Keith Yamamoto. Motion carries.
Thank you, Maria. Item 12, consideration of appointments of a new member to the Accessibility and Affordability Working Group. So I will take this one. So as you recall, Prop 14 specifies that the AAWG have 7 ICOC members. I've asked Senator Torres to chair, so it's Art, myself, plus 5 other members of the ICOC. One of those original appointed members was Dr. Brashear from UC Davis. She, as you know, is no longer dean there, has gone to another position elsewhere. So it opened up one of those positions. And I've asked Pat Levitt if he would step in and fill that open position. I think Dr. Levitt will bring great expertise, not just in general, but has the added benefit of bringing the children's perspective to the table in this, which is, of course, a very important component. So I wanted to ask for a motion to approve adding Dr. Levitt to the AAWG.
So moved, David in San Diego.
Thank you, David.
Second, Haifa.
Okay, we'll give Haifa that one. I think she got in a little before Dave Martin, but Dave's been on seconds before, so we're spreading it around. Okay, are there any questions or comments? Any questions or comments from members of the board?
Yes, this is Art. I just want to thank you, Pat, for agreeing to serve on this working group. And I've never told you, but it was Children's Hospital that saved my son's life many, many years ago. So I'm so happy that you'll be part of this new initiative.
Art, thanks very much. And I do want to say that JT is one of the best arm twisters I've ever encountered.
Thank you, Pat. Any other comments or questions from members of the board? Any comments by members of the public?
There are none.
Okay, hearing none. Maria, we
Haifa Abdullah,
Yes.
Jen Bernal,
Aye.
George Blumenthal,
Yes.
Leandra Clark Harvey,
Yes.
Anne Marie Dulage,
Yes.
Isabel Dudon,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Yes.
James Kovach,
Yes.
Rich Lahara,
Yes.
David Lowe,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Melmed,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
yes.
Art Torres,
Aye.
Christina Vori.
Yes.
The motion carries.
Thank you, Maria. Next item, consideration of increasing percent effort of ICOC vice chair in light of additional duties. I will take this one as well. There's a memo that's posted online with respect to this. In short, Art has been serving as vice chair, performing all of his many roles since 2009. During that time frame, he's been deemed an 80% time employee. As noted, I've asked him to chair the AAWG, which, in addition to its 7 board members, has 10 outside experts and up to 15 new members of the team specifically devoted to that major undertaking. Last year, we spent basically finding and appointing and approving the appointment of the 10 additional board members. So we are now ready for things to begin in earnest, which they are this month. And because this is a very substantial additional increase in work, I'm recommending that Art be deemed a 100% time employee for the balance of his tenure here as he works as chair of this new working group. Do I have a motion to that effect?
So moved.
Moved by Dr. Gasson. Do I have a second?
Second.
Second.
Okay, I'm not sure who the second was. Who's that? It was
I believe it was Dan.
Dan. Thank you, Dan. Any questions or comments by members of the board? Hearing none. Any comments from members of the public?
There are no questions or hands raised.
Hearing none. Maria, will you please call the roll?
Yes. Haif Abdulhak,
Yes.
Dan Bernal,
Aye.
George Blumenthal,
Yes.
Leander Clark Harvey,
Yes.
Anne Marie Dulege,
Yes.
Isabel Duron,
Yes.
Mark Fisher Colbury,
Yes.
Fred Fisher,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgard,
Aye.
Jim Kovach,
Yes.
Rich Lahara,
Yes.
Pat Levitt,
Yes.
David Lowe,
Yes.
Linda Malkus,
Yes.
Dave Martin,
Yes.
Shlomo Malmed,
Yes.
Lauren Miller Rogan,
Yes.
Adriana Padilla,
Yes.
Joe Panetta,
Yes.
Michael Stamos,
Yes.
Jonathan Thomas,
Yes.
Christina Vori.
Yes.
The motion carries.
Thank you. On to item number 14, which is discussion and update of performance audit. As you recall, we are mandated to have a performance audit every 3 years. We've heard at past meetings discussion of this recent iteration. In the process of the performance audit, the auditors submit their findings, and as is normally the case, we respond to those findings in writing. Those findings and responses have been posted online, and rather than sort of go through them piece by piece, would just note that the team has comprehensively answered all of the questions. If any members of the board has any question about any of the items, any of the responses, or other general comments on this, now would be the time. Do we have any such questions or comments? Okay, hearing none. Are there any public comments? I would just like to note that all of this considerable effort putting this together was led by Maria Bonneville. So we'd like to thank Maria and her team in putting these responses together. Having said that, Maria, will you please call the roll?
This is actually not a
just
voting item.
discussion. Sorry, just
Exactly.
a discussion. Right, no vote. Don't need a vote. Okay, so that concludes the agenda here, except for general public comment. Do we have any members of the public who'd like to comment on anything, on any subject?
I believe we do have one, and I think Kevin McCormick will be reading those comments.
Okay, thank you, Kevin.
Chairman Thomas, members of the board, can you all hear me?
Yes.
Great, thank you. I'd like to read out a statement from Nancy Renee. Well, Nancy is a longtime stem cell and particular CIRM supporter. She's been really active on our behalf, in particular in issues surrounding sickle cell disease. She's also the patient representative on one of our programs looking at sickle cell disease. And Nancy says, thank you all for the work you are doing on behalf of all Californians, leading the way in stem cell research. For communities in poverty and communities of color, there are several obstacles blocking access to these life-saving, life-changing cures. As I see it, one of the biggest obstacles is lack of trust in a primary care physician. If I or a family member was facing a medical challenge, I would start by getting advice from my primary care physician. I might ask about stem cells. Perhaps I'd done some research and decided I might get the medical help I needed through the use of stem cells. If my doctor was knowledgeable, I might consider a research study. If not, I would look to other options. If my doctor was whoever showed up at the ER, I'd be out of luck. For many reasons, poor and people of color lack access to primary care. Doctors are located in Santa Monica or Beverly Hills, and they certainly don't take Medi-Cal. And who can afford to pay $20 to park their car? CIRM has already begun to bridge this gap with a major project at Benioff Children's Hospital in Oakland. Congratulations for that. Please develop more programs that reach out to doctors in public hospitals so that they too can suggest patients for your studies. Once the trial is at phase 2, I hope there can be a person who is a kind of liaison with the community. This could be a person who understands the science, but more importantly, has connections to the community. I understand that CIRM has this kind of position in the works. Just know that trust building must have a major emphasis. If nothing changes, nothing changes. I would hate to see research studies that do not include poor people or people of color. I hope to see research teams and doctors who look like me. Patients can't do it alone. They need trusted professionals, trusted doctors and nurses who work in their neighborhoods. These folks can all make a difference. Thank you very much.
Thank you very much, Kevin. That's a very important message. Like to, as always, thank Maria, Marianne, and Doug for putting all the hard work into making this happen. I would like to close and note that how lucky the state of California is for the second time in 4 months to have a major battle between our professional sports teams. I put in a call to Mr. Julesgaard so that we could brag about our respective football teams in advance of the upcoming NFC Championship game. That was fun as always. Then called Mr. Roulette, only to find out, since he was such an ardent Giants backer, that he in fact is a Cowboys fan and really didn't have much to say on the subject one way or another. But I figure if we really want to indulge in some real trash talk, that I should yield the floor to Dr. Kovac, who actually played for the 49ers and is certainly unique amongst this board or many others to make comment. Jim, would you like to say anything?
I think, yeah, thank you, JT. I think you just need to look at the last 6 or so games to give you a read on who's going to win this one. So,
yeah, that was cold. Thank you very much for that analysis, Jim.
Go Niners!
JT, I think you really need to come to my Pilates class where you'll get a real throwdown with a couple of my fellow women Pilates members who weren't really excited by either of the teams on the field.
Well, there you go.
They were rooting for some back east folk. It's very interesting, but I'll pass on your sentiments and tell them you're willing to take them on.
Yes.
And whoever else wants to take them on.
Yes, well, thank you. I refer everybody to Jim. He's a much tougher customer than either of us. So with that, we will thank you again for a very productive meeting and discussion on all topics. And Maria, what is the date for our next full board meeting in March? We of course have the application review subcommittee in February. What is that date?
Sorry, you want the March date?
Yes.
I believe it's the 24th, and yes, it is.
24th. Well, we will see the full board then, the application review subcommittee, which of course includes the full board in the interim. And meantime, go Rams. We stand adjourned.